Good morning. Welcome to the Finance Administration Committee meeting for the Board of Commissioners. And it is September 5th, 10 a.m. approximately. First order of business is public comment. Please direct all comments to the board chair. You have approximately 3 minutes to speak and provide your name and where you live. Thank you.
Good morning, Commissioners. Adria Hill, Holland Township. In a recent press release posted on their own website, Commissioners Moss and Rohde reminded us that the Health Department has an excess of $3 million in their fund balance. What wasn't addressed in that press release was why they have that fund balance. $1.7 million is already earmarked for special purposes, leaving $1.3 million available to be used. The intent of having the fund balance is so that the Health Department could react in an emergency situation. It allows them to prioritize the safety of our residents over jumping through bureaucratic funding processes when an emergency situation occurs. In the last few years, COVID-19 was certainly one of those situations where the Health Department needed to lean on its emergency response plans. While it will be a scenario that goes down in the history books, this is not the only emergency response that the Health Department has needed to be prepared for. July 2012, the Health Department was contacted by Holland Hospital, who had several patients with similar symptoms after eating at the same restaurant. The Health Department was able to confirm that an outbreak was occurring, and it temporarily closed the restaurant to prevent the spread of a gastrointestinal illness throughout the community. Another example, the Health Department has worked with local poultry farmers to make sure that their chickens, eggs, and turkeys are protected against avian flu. In 2018, they responded to PFAS contamination in a Grand Haven Elementary School's drinking water. The Health Department initiated its protocols to establish a multi-agency response. It also coordinated with the Sheriff's Department to supply and distribute bottled water to students and staff for drinking and cooking. August 2021, the Health Department helped respond to a hazmat situation when a white dry powder was released into downtown Zeeland by a local manufacturer. Last year, they were involved with an E. coli breakout at multiple Wendy's restaurants. And this year, they played an important role in making sure the Critter Barn was a safe place after they had a parasite breakout. I worry that if the Health Department is forced to utilize their balance to fund this year's operations, that our county will be ill-prepared for situations like the ones I've just mentioned. Let's not cut off our nose to spite our face.
Thank you. Morning.
Hello, I'm Pat Smith from Grand Haven Township. Thank you for this opportunity. I'm your friendly local economist. So I'm here also to talk about the proposed cuts and changes at the Public Health Department. I don't recall seeing any news reports of incompetence or misbehavior at the department. In contrast, I remember reports of them getting both national and state recognition for emergency response planning. One argument I heard in favor of cutting the budget was that they were just returning to pre-pandemic levels. But then there was disagreement on the board about what that pre-pandemic level actually was. And I was frustrated that the newspaper didn't settle it. I looked for the data online. It's not available. When I asked for it, I was told I'd have to submit a FOIA request. So I can't assess the quality of that argument. I do know the population of Ottawa County has risen. I do know that inflation has occurred. So we're trying to serve more people, and it's more expensive to do so. I've done some research on Medicaid costs of unintended births. I found a positive association between lack of family planning and more Medicaid spending. The counties that had the less spending on Medicaid births were the ones that had more family planning available. I've also am aware of a study that showed that $1 spent on public health reduced spending on Medicaid by more than $1 through the prevention of serious disease. So from where I'm standing so far, I don't see how these cuts or the restrictions on the director are going to promote community health. To me, it seems more likely that it would hurt community health, which I think is our shared priority. Thank you.
Thank you.
Good morning. My name is Martin Berent. I'm Park Township resident, member of Ottawa County now for over 20 years. It's great county, and also on staff at Holland Hospital, 20-year member at Lakewood Family Medicine, and on board with the physician hospital organization that works with Holland Hospital. So I'm representing myself, but I believe I represent sort of a tip of the iceberg as far as healthcare providers in the community. You know, I support the Ottawa County Department of Public Health and its actions throughout the pandemic. The quality of care that we offer to each and every resident of Ottawa County simply cannot continue without a fully functional Department of Public Health, one that is functional and robust. The COVID-19 pandemic exposed a chronic underfunding, this was reported across the nation, of infrastructure of public health. You just heard a few examples of what public health, of why it's important. Our goal should not be to reduce this level of investment into our collective health. Well, a few of the reasons I've come up with is this ongoing growth of Ottawa County's population, the unprecedented inflation that we're all dealing with, and increased costs of staffing that we all feel. They're all factors that require full funding of the Ottawa County Department of Public Health. Reducing the budget will negatively impact the health of our community. You know, I didn't even mention that this pandemic has brought on an upsurge of substance use disorder that we're dealing with, opioid overdoses, sexually transmitted infections, and mental health crises. I'd like to remind you that Ottawa County's exceptional healthcare is often cited by potential residents and businesses as the reason why they move to this area. I am concerned that dramatic reductions in the Department of Public Health's budget will not only decrease the health of our community, but also result in an unintended reduction in Ottawa County's current level of prosperity and growth. Thank you again.
Thank you. Good morning.
Good morning. My name is Danielle Dykens. I live in Holland Charter Township, and I'm the Deputy Clerk for Park Township. I'm here to speak in favor of the agreement for early voting administrative services and election budget requests of the Ottawa County Clerk and Register of Deeds Office. I'm an elector in Ottawa County and a local election administrator. The benefits of the agreement of early voting administrative services are numerous for the local jurisdictions. I encourage each of you to reach out to your local clerk to review the benefits realized in their respective communities. Today, I'm here to discuss the benefits of the agreement to fulfill the early voting requirements of Proposal 22-2 for our electors. The first one is convenience. Voters can vote at any one of the four proposed centralized locations in Ottawa County. The agreement provides for the polling locations to be open morning and evening hours in addition to 32 hours over 2 full weekends throughout the 9 days. The second is cost savings. The cost savings to the taxpayers of Ottawa County will be realized in shared services, staffing, and equipment purchases. The third and most important, I believe, is election integrity. By having this agreement in place to allow the county to administer early voting throughout Ottawa County ensures each of the locations are held to the same processes. I ask that you support the Ottawa County Clerk, Register of Deeds Office, and the 23 local jurisdictions in favor of the cooperative agreement and approve the budget requests. Thank you.
Thank you.
Teresa White, Robinson Township. Commissioner Cosby, the two questions you asked recently regarding Ottawa County elections. First, ERIC is again another data collection of voting information at the county level, goes up state level, and then gets passed on to other states. Louisiana and Texas are the latest to leave ERIC. If Texas can figure out a way to clean their own voter rolls, I think we could too. Second, the watermark ballots. During poll training recently, I observed 8.5 by 11 paper from the ballot marking devices that was being directed to be inserted into the tabulator. I asked Paul Lilly about this because the paper was not the size of the ballot. Yet the tabulator was able to read it and count the votes. So something within the tabulator is adjusting sizes to read these sheets of paper. I asked my clerk about this. She said the paper didn't matter because the QR code is what the tabulator was reading. So in Georgia, a sheet of notebook paper was found to have been within the ballot images counted within their tabulators. It was found out there in Georgia that all the tabulators had their ballot paper verification within the tabulators turned off. My question would be, are ours turned off? And if so, why are we purchasing any premium paper? Also, I would ask who disabled this feature if we are using regular copy paper. I didn't finish training because there should be more concern about what is happening inside the tabulators. Thank you.
Thank you. Good morning.
Good morning, everyone. My name is Megan Zickes. I apologize, I'm getting over a cold, so got the voice stuff going on, better go to the health department. I have lived in Allendale for over 23 years. I'm a mom, I have 3 kids. My middle one is adopted, and I thank the beautiful court system that we have here on making sure that that went through smoothly. I also served on the school board there for 10 years. And as some of you are aware, because we've had conversations about it, I recognize that a contentious board really hinders any public process and any ability to move forward to support the constituents that are present. At one point, somebody had told me and described me as a classic utilitarian. And for those of you that are unfamiliar with that, it's somebody that believes very much in what is good for all, what is best for the most amount of people. And tends to be very impartial and follow good law. So today I'm here to encourage you to support the good policy that I believe that you truly were elected to do. Transparency, shared documentation, accountability, and compliance. It protects not one of us, it protects all of us. To that end, as an attorney, I would like to point out a few things. I believe that the fees that have been put forth in the budget are grossly underestimated. As a lawyer, they're either undercharging you or you're not accounting for it in your actual numbers. Commissioner Rohde mentioned that the county was out of compliance with certain statutes. I would like to have that information presented so that we're clear on what compliance is not being done. I would also like to say that as a former election inspector, we really need to support the clerks, the early voting agreement, cost-effective, collaborative, and consistent communication. In addition to being a resident of Allendale, I also serve at Grand Valley and on the State Ethics Committee for the Michigan Department of Health and Human Services. The growth feeds the budget. This is the fastest growing county, and Allendale is the fastest growing township in the state of Michigan. It is incumbent that we do just as Mr. Moss suggested and look at the data. We have to make decisions that reflect that numbers, and we have to make sure that people's voices are heard when we make those decisions. I do not believe at this point that I have heard that the Finance Committee has met to discuss some of these budgets. Finally, I would like to speak for our children. They are what guides us. And just like parenting, governing requires clear expectations, clear love, and a moral imperative. You have to have the courage to deliver to your upcoming. We are parents, Mr. Moss, and we demand excellence. And now I demand it from you.
Thank you.
Good morning.
Good morning.
First of all, thank you for the opportunity to provide public comment. My name is Jody Hanson. I live in Allendale Township, and I have the privilege and opportunity of serving the clerk for that township. So it's my hope that you see the value of 23 jurisdictions, along with the county clerk's office, partnering together collectively to fulfill the constitutional requirements of Proposal 2, which I'm sure we're all happy to hear about, but that's what we're here to talk about. So not only does countywide early voting collaboration increase continuity throughout Ottawa County, but it's also going to provide a convenience our voters have yet to imagine. It reinforces the sanctity that our clerks place on the integrity of elections by uniting to ensure streamlined and uniform processes. In addition to the many great benefits that some of my colleagues have probably already highlighted, there's also a very impactful financial advantage. So I'm here to highlight a small sample of some of the estimated cost savings. For smaller jurisdictions, some estimates show each smaller jurisdiction will save as much as $50,000 every 2 years by partnering together and with the county. Us medium to larger jurisdictions
We have estimates that show jurisdictions could save as much as $28,000 every 2 years by partnering together. If each of the 23 jurisdictions hosted early voting on their own, estimates show cost of approximately $1.3 million every 2 years. By partnering together, we can save Ottawa County taxpayers approximately $597,000 every 2 years. Those are pretty impactful numbers, and I'm hoping that you see the value in the partnership. So as members of the Finance Committee, I know that you're very aware of the impact decisions have on taxpayer dollars and the extreme importance of fiscal responsibility. It's my hope that you see the positive impact for every taxpayer and voter in Ottawa County by supporting the local clerks and the county clerk as together we implement Proposal 2. So the bottom line is we have no choice but to fulfill the requirements of Proposal 2. However, we do have the choice and the opportunity to ensure we implement and fulfill the requirements correctly and responsibly. I ask that you consider the benefits that have been presented, and I ask that you support the county clerk in his request for early voting and election needs. Again, I thank you for your time.
Thank you.
David Moore, Allendale Township. Cost savings, elections. I'm going to tell you straight up, elections are the most important thing there is to a republic. There's nothing greater. The integrity of that election is what matters, not the cost of it. We need integrity in our election system above all else. So if there are rooms and if there's doors and there's opportunity for people to cause trouble, it needs to be shut. That's where the money needs to be spent. It needs to be done, whatever it has to make sure that we know that irregardless what our government says, that it's honest, that only American citizens have voted, and it's accurate. Thank you.
Thank you.
Good morning, Rob Davidson, a resident of Spring Lake Township and also emergency physician. And a couple of years ago, graduated of Michigan School of Public Health with an MPH. I just brought this as a reference for the Michigan Public Health Code. I'm here to speak on behalf of the health department here in Ottawa County and the continued funding to maintain its excellence. I think depending on the ranking system you look at, Ottawa County is listed as the #1 or #2 healthiest county in the state of Michigan. That doesn't just happen by accident. That's not just because people happen to locate here who are healthy. The health department has been a pillar of upholding that the health of this community. Looking at the Michigan Public Health Code, there are contractual standards that exist, and the health department is responsible for various items. I'll list them off here and then just want to talk about a few. Food protection, groundwater and public water supply, sewage disposal management, hearing screening, vision services, sexually transmitted disease control and prevention, immunization and infectious disease control. Since I'm only supposed to address the chair, I will, and thankfully this is I know you've talked about Chairperson Cosby being a nurse. I don't know if currently or if in the past, just to think about days as a nurse, and I can think about my days since 1998 being a physician. Wonder if you had ever heard of Haemophilus influenza B. You have, I have. I learned about it in textbooks. I never saw a case in my career. Haemophilus influenza B was a bacterium that caused a horrible disease, the leading cause of meningitis in kids under 5. Also caused a horrible disease called epiglottitis. Those of you who have kids probably heard kids with croup. They get a barky seal cough. They can barely breathe. Back in the day before I was a resident in 1998, people had to differentiate between croup and epiglottitis. And because there was no immunization against Haemophilus influenza, kids got admitted to the hospital. They got x-rays. They got unnecessary treatments. Haemophilus influenza B was essentially eradicated because of immunizations, because of health departments immunizing kids. Also want you to think about women with infertility. When someone has a sexually transmitted disease, typically chlamydia, gonorrhea, and it is left untreated or they have repeated episodes, they can result in them being infertile. We have a health department that has to find cases and find contacts and identify folks and let them know that they've been exposed and get them treated. And then the final thing would be disease outbreak investigation. If you've all heard of E. coli 0157H7, Jack in the Box outbreak, and the West Coast was a really, really big one. And back in the 80s or 90s, it causes a disease called hemolytic uremic syndrome. Kidney failure happens most often in kids. Health departments identify clusters of cases of diseases like that. I let the community know. They shut down the distribution of those foods that do that. So please, Chairperson Cosby, think about your time as a nurse, not about as a political operative with Ottawa Impact or as a commissioner, and think of the health department is in preventing these terrible
Thank you.
outcomes.
Further?
My name is Gail Harrison. I'm from Grand Haven Township. And I applaud Dr. Davidson's remarks. I simply want to say, as a resident of Ottawa County and a voter and a person whose family has benefited from the Ottawa County Health Department, I'm outraged, simply outraged by the behavior, the retaliation, the punitive behavior of this particular county board, with the exception of a few folks. I hope you reconsider and support our health department. Thank you.
Thank you.
Derek Mullenberg, Holland Township. I'm a numbers guy, so I do at work. So I was intrigued when Commissioner Moss pushed to anchor the discussion in $2.5 million as a budget. Anchoring is a way of framing the conversation toward your desired outcome. I was similarly surprised by the lack of supporting documentation for this figure. In all the budgets I've been involved with, there have been an initial amount budgeted, which is typically the historical budget, maybe last year, with accommodations for inflation and demand, and use that baseline to create scenarios against. As I'm sure you're all aware, inflation has been anything but normal for the last 5 to 7 years. Has Commissioner Moss kept the prices for his customers the same since pre-COVID? I doubt it. The demand for healthcare has also been atypical. Two important things to have in mind when looking at what a reasonable budget looks like. I went back and looked at historical general fund contributions for the health department all the way back to 2002. I was shocked to find that even in 2002, the general fund contribution was 2.9 or $5 million in today's inflation adjusted dollars. So how did we arrive at 2.5? What logical explanation can justify this amount? That's when I realized there isn't a logical explanation. The desire to move back to pre-COVID levels while ignoring inflation, services offered, and excluding grant money is all pretense to continue your efforts to remove the health director from her legally appointed position. Why do I say this? Well, the answer is pretty simple. If you were about saving taxpayer money, you wouldn't have agreed to an escalation in billable rates for corporate counsel. You probably would have denied Administrator Gibbs' request for an assistant. You would have agreed that a upgraded communications director was an unnecessary expense. You would have FOIAs answered by the least paid hourly employee capable rather than corporate counsel. You would have started actual budget negotiations in June instead of requesting a full rework of the budget with a 2-day turnaround in August. I invite the commissioners to visit a school this fall, tell a student that's unable to focus due to an untreated cavity that unfortunately the smile bus may show up less frequently, but we appreciate your sacrifice towards balancing the budget. Visit a consumer of children's special health care and let them know you're sorry they can't reach out to a nurse right now, but this is the new normal because the pandemic is over. You need to adjust. I would support reducing the budget for the health department if there was a reason to do so, like in 2009 when the economy tanked, but there isn't. And if there was, you guys would have already been working on it. The health and welfare of the citizens of Ottawa County should not be used as a pawn in your chess game. Thank you.
Thank you.
Megan Ryan, Holland Township. Chair Cosby, at previous finance work sessions, you have supported department heads making decisions on cuts for their departments and declined to support a specific budget number for the health department to cut to. In the August 10th work session, you agreed when Mr. Moss said the board is not running the departments. You said about a 5% budget cut, quote, That can be a decision that is made departmentally, end quote. On August 21st, you said that after looking at new work and the volume served by the health department, quote, I think we'll get maybe a different number than the 2.5, end quote. Despite this, from the chair of the finance committee, we know Mr. Gibbs asked Ms. Hambley for a budget of that $2.5 million. Mr. Gibbs and Mr. Moss have said the county requires cuts to the health department budget, even if that total number keeps changing, despite there being no vote from this committee or the full board on the matter. Ms. Hambley has been shut out of the budget process. As chair of the finance committee, do you sanction these actions? Were your words at the work sessions meant to placate the public while you worked on something behind the scenes? Or has all this activity been going on without your awareness or blessing? I hope you'll make that clear today. I'm concerned about the proposed cuts to the health department budget, but I'm also very concerned about the process that got us to this point, though I think it is generous to call it a process. Perhaps there are parts of this budget cycle that have been made more transparent, but all these decisions about the health department seem to be being made behind closed doors. This committee hasn't voted on any changes to the budget. The chair of this committee hasn't even called for specific changes, only more data to drive the conversation. Transparency is not throwing out numbers with no context in retaliatory press releases or on campaign websites. That's no way to set a budget. I support Ms. Hambley as health officer, and it is disingenuous to call her insubordinate for pointing out the consequences of these proposed cuts when other department heads were allowed to say that making a 5% cut would be too hard to do in short order on their own. I also support Commissioner Bonema remaining vice chair of this committee. He has shown initiative in trying to get answers rather than just asking questions, and in attempting to collaborate and find solutions. These are leadership qualities that should be celebrated, not punished. Thank you.
Thank you. Good morning.
Gail Roloffs, Allendale. Last night I happened to go back through the June 2023 Ottawa County Health Department service meeting. And at that time, both Ms. Hambley and Dr. Gwen stated that the health department was meeting people where they are. And they were out in the community to provide information. And that was at the Grand Haven Pride Festival, the Holland Pride Festival, and they were at community events and farmers markets and things like that. Well, Allendale had their back to school fair just a few weeks ago. 2 years ago, the health department had big signs like this size. One said free COVID vaccines and the other said free condoms. This is for elementary age school kids. So I addressed this with the school and whoever was ahead of that. Last year, no issues with the health department. They just had paperwork out and answered questions. I went to check this year. The health department wasn't even there. And I asked the gal that was in charge. She says they were invited, but they were also told this was a family-friendly event. I'm really saddened and dismayed at the health department's lack of respect and unable to follow the chain of command with their TV and newspaper interviews. We have a communications director. That's who they're supposed to be going through. Thank you.
Thank you. Is there further public comment? Good morning.
Good morning. Good morning. I'm Terry DeYoung, City of Holland, and I'm here to ask you to support the Ottawa County Clerk's Office by allocating the funding the clerk is asking for. Clerk Roebuck and his staff run secure and fair elections in Ottawa County, and funding is necessary to continue this work. Elections are critical infrastructure in our democracy, and they need to be funded as such. Threats to our democracy continue across this nation, and as our Board of Commissioners, we need you to support all eligible voters so that they have their access to the ballot box. This includes historically disenfranchised communities, including Black and Brown people, rural residents, people with disabilities, young people, and people with low incomes. I've lived with a disability my entire life, and I have a particular concern for ensuring accessible voting for disabled people. My personal preference is to vote in person rather than by mail, partly so I can use the voter assist terminal at my polling place, not because I personally require that accommodation, but to ensure that somebody in my precinct uses it and that our precinct workers know how to operate it. In the most recent election, the voter assist terminal was tucked in the corner with no signage, which I pointed out to the election workers in my precinct. In conversation with the clerk's offices, both in the city of Holland and here in Ottawa County, both named the high anxiety election workers have around voter assist terminals. They are expensive and they can be tricky to set up properly and troubleshoot. Proper funding is essential to maintaining voting equipment and to train election workers. With the new early voting requirements and the county's responsibility to staff multiple polling places for 9 days before Election Day, all with full accessibility, ample funding is even more essential, and a consistent message that educates voters will also be needed. I am deeply concerned about Ottawa County. Your actions as a board since January, especially eliminating the DEI office and now your cuts to public health, have deepened my concern that you're making this county a place where it's very hard to feel we are safe or respected or have full access to services that will be a priority.
Thank you
Thank
very
you.
much.
I just was gonna try to hook this back up.
Thank you. Any further? Oh. Good morning.
Good morning, Commissioners. I'm Rebecca Patrick from Allendale Township. I'm here to speak about the budget. A few fast budget facts. There have been not one, not two, not three, not four, but 5 significantly different variations of the public health budget in the last 19 days. These are not minor tweaks here and there. They have involved major crazy cuts. First 33%, then 63%, then 57%, then 13%. It looks like the driver of this bus used a random number generator. We have also observed a non-existent process where a couple of you appear to have been speaking for all of you, even though you've taken no votes. And the most concerning thing of all is that we are talking about public health here, not buying staples or reams of paper. There is no possibility that any of you clearly understand who might be affected by these cuts and how. So now might be a good time for a short story to remind us all about what happens when government officials don't value public health, act arrogantly, and make hasty decisions. Once upon a time, there was a community of people. Their government leaders decided they wanted to cut costs. They wanted to cut costs more than they wanted to keep people safe and healthy. The people in charge of making the cut didn't know or didn't care, or both, what would happen to people if they cut these costs. All they could think about was cutting costs. So they made the cuts. They held on to the money. They told everyone it would be fine. And they kept saying that, even though it became apparent that children were falling ill and people were dying. Who were these unfortunate people? Well, they live very near here in Flint, Michigan. It's a story about government officials who poisoned children and killed at least 9 people because they arrogantly, hastily, and needlessly prioritized cost cutting above public health. But here's what also should be of interest to you. It's also a story about 6 government officials who got charged with felonies and involuntary manslaughter because they didn't take public health seriously. I worked with some of these folks. It ruined their lives and their bank accounts. And it all happened because they weren't willing to stop and think and review and understand. They just cut. Commissioners, I don't wish this for you or for Ottawa County. Remember that these hasty, ill-considered actions on the public health budget are not necessary.
They are going to have consequences for all of Ottawa County, but they may also have very serious consequences for you personally. Thank you for your time.
Thank you. Are there any further public comments? Good morning.
Kim Nagy, Georgetown Township. I asked at the last Finance Committee meeting for Commissioner Rhodey to provide the statutes and the costs that she indicated that we were not meeting in terms of veterans affairs and help in looking at creating a department. I asked in public comment that that be made available. To my knowledge, it has not been. I followed up with emails and have not been responded to on that question. Regarding the health department, we have a new crisis on our hands. It's called Ottawa derangement disorder. I think we're going to need to have a study of this. When we have consensus in government, when you listen to your constituents and you represent all voices, you hear all voices, you get better government. That's what Gary Peters did when he pushed through a veterans package of benefits in the Trump administration. When we hear from leaders in this county that anyone who has a different view or wants to bring a new subject to an issue is deranged, this does not lead to good discussion, to consensus, or to a sense that our commissioners are working for the common good. Please consider language.
Thank you. Good morning.
Good morning. My name is Daryl Fisher. I'm a resident of Grand Haven. Nearly everyone who has come up to this podium this morning has spoken in favor of continuing to support the wide variety of services that have been provided by our county's Department of Public Health, be they routine inspections or avoidance of dire emergencies. We know that all of these services cost money. We know there's inflation. We know our county is growing, and yet we're talking about cutting the fees drastically. It's a moving target. We don't know the number, but let's say it's somewhere in the neighborhood of 60% of the budget. I dare say that everyone in this room, all of us and our families have needed and will continue to need these services from our county. So my question is this: if the budget is going to be cut by 60%, what services will we, those in the room and those in the county, no longer be able to count on? Thank you.
Thank you. Are there any further public comments?
Joe Spalding, Holland Township, reading today from the Gospel of Matthew. Then Jesus was led by the Spirit into the wilderness to be tempted by the devil. After fasting 40 days and 40 nights, he was hungry. The tempter came to him and said, "If you are the Son of God, tell these stones to become bread." Jesus answered, "It is written, man shall not live on bread alone, but on every word that comes from the mouth of God." Then the devil took him to the holy city and had him stand in the highest point of the temple. "If you are the Son of God," he said, "throw yourself down. For it is written, he will command his angels concerning you, and they will lift you up in their hands so that you will not strike your foot against a stone." And Jesus answered him, "It is also written, do not put the Lord your God to the test." Again, the devil took him to a very high mountain and showed him all of the kingdoms of the world, including Ottawa County, and all of their splendor. "All this I will give you," he said, "if you will bow down and worship me." Jesus said to him, "Away from me, Satan, for it is written, worship the Lord your God and serve him only." Then Satan pissed off and the angels came and attended to him. Imagine reading this. Imagine hearing about Christ being tempted by food after starving himself for 40 days. Imagine hearing that Jesus himself rejected dominion over all of earth, including Ottawa County. And then, thinking that the best way to celebrate Jesus' life as a Christian is to get yourself elected on a county commission, declare that against his word that Ottawa County of this earth is in his dominion when he's supposed to be seated at the right hand of the Father and ruling in heaven, and then vainly claiming that you're speaking for him whenever you give a political speech. Imagine that, and then imagine the 10 Commandments, and then imagine burning in fiery furnaces of blackest hell for all eternity for being so vain and for having so much hubris.
Thank you. Are there any further public comments? Seeing none, we'll move on to approval of the, sorry, Adeline.
Adeline Hambley, I'm the health officer for Ottawa County. Normally as health officer, I wouldn't sign up for public comment to address the board, but these are unprecedented times. As I have not been invited to any discussions in the past 2 weeks regarding the budget for the health department, I'm not sure I'll be invited to speak later in this meeting. County Public Health provides an array of services and education programs required by law as well as local need. To receive funding from state and federal partners, they must 1, meet minimum funding requirements, and 2, meet minimum service levels. Failure to meet either of these requirements risks loss of state and grant funding for the local health department. This could lead to legal action or state intervention. Pardon me. I'm glad to see this latest version of the budget meets the maintenance of effort requirement for some programs, but still some funding and legal problems exist with the budget proposed. Administrator Gibbs' instruction 2 weeks ago was to create a budget cutting the general fund contribution to the health department down to 2.5 million, over a 60% reduction from the budget I submitted in May. And it would have resulted in the health department not meeting minimum funding level or minimum service level requirements. After attempts to communicate these concerns to Administrator Gibbs went nowhere, it was important that I be transparent with the rest of the commission and the public and communicate the risk to public health if funding moved forward at 2.5 million. Certainly, a funding cut to the level that the health department can no longer operate is a threat to the public health of our community. Administrator Gibbs moved forward instructing that fiscal services drop a budget without public health input. I was provided that budget, the budget that you're discussing today on Friday afternoon. This did not allow enough time for me to completely determine what the proposed cuts mean for services. But it seems at some point you realized I was telling the truth that the health department could not operate on a general fund contribution of 2.5 million, as the amount now in play is just over 4.3 million, nearly 2 million more than the budget I was asked to create. This amount is still far less than is needed to provide our core services, an amount that was determined through the normal budget process with fiscal services and public health. The same process is followed by all other departments. In today's version of the budget proposed by Administrator Gibbs, there are cuts to immunizations, STD testing and prevention, communicable disease investigation and prevention, and health promotion programs. Health promotion includes suicide prevention programs, substance use prevention programs, and food assistance for individuals, families, and children. Today's version of the budget also reduces the Miles with Smiles dental program for uninsured children. In some instances, you are literally taking services out of the mouth of children with these actions. This is not a return to pre-COVID budget levels, since it results in cuts to services and positions that existed pre-COVID. I was asked to be here today by Administrator Gibbs, which I'm happy to do, and I hope that you will ask me for input as you discuss this budget. Thank you.
Thank you. Any further public comment?
Hello.
Good morning.
My name is Kylie Beisk. I am a professor of public health nursing. I work as a pediatric sexual assault nurse in Ottawa County. And I just ask that rather than considering the political impact of this, you filter this with a lens of the people that this is going to directly impact and the disadvantaged of our society, the people that the Miles of Smiles van sees that these children otherwise wouldn't see a dentist, the immigrants that come to Ottawa County Health Department for their vaccinations, or the migrant workers that are being diagnosed with complicated strands of drug-resistant tuberculosis that are treated and then putting others at risk in our community if they're not. We, as a community, tend to find it uncomfortable to think of the situations that so many people are in. And unless you have truly been in those situations and have experienced that level of desperation, it's hard to empathize and identify. But the millions of people that are in our country every day that are depending on these services are going to be directly impacted. And there are children that cannot advocate for themselves that are going to be directly impacted by these budget cuts. I spent some time working at the Ottawa County Department of Public Health, and I have seen all the good that they do. And to take these services away from these children and these people who are in a place of disadvantage at a time when inflation is at its highest and these services are needed the most is, I think, inhumane.
Thank you.
Well, I'm Christy Mackling from Zealand Township. I'd just like to take a quick minute. No one has stood up here in support of the budget work that's being done. I believe I speak for many when I say I do support. I think there's a lot of fear going around. Ms. Hambley says she's talking about all these things that are going to be cut, but yet she says she's not part of the budget process. So I find that a little confusing. I trust that you guys will do what's right for the county. I know that you know what's needed for the county. Thank you for your hard work.
Thank you. Any further public comment? Seeing none, we'll move on to the approval of the agenda. Do I have a motion?
A motion to approve the agenda.
Second.
And we'll go to a vote. All those in favor, say aye.
Aye.
All opposed, same sign. Moving on to the consent resolutions is the approval of the minutes from August 1st, 2023 Finance Administration Committee meeting and the August 21st, 2023 Finance Administration Committee meeting, our special work session. Do I have a motion?
A motion to approve the consent resolutions.
Second.
Is there discussion? Seeing none, we'll go to a roll call vote because I think that
You should be good to just.
we're okay.
Yep.
All right. So all those in favor?
Aye.
Say
Aye.
And opposed? Motion passes. Moving on to the agenda and action items. Action item number 1 is a statement of review. The suggested motion is to approve the statement of review. Do I have a motion? So move.
Support.
Is there discussion? Seeing no discussion, we'll move to a vote. This one would be a roll call. This is a statement, or we can go ahead and do it. Okay, just dollars and cents. So all those in favor for this, to approve the statement of review?
Aye.
Aye. And those opposed? Nay. The motion passes. Accounts payable for July 24th, 2023 through August 25th, 2023. The suggested motion is to approve the general claims in the amount of $25,296,425.32 as presented in the summary report for July 24, 2023 through August 25th, 2023. Do I have a motion?
So moved. Second.
Okay. Is there discussion? Seeing no discussion. This one will go to a roll call vote.
Yes.
Yes.
Mr. Belknap,
Yes.
Mrs. Curran,
Yes.
Mr. Moss,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mr. Zylstra,
Yes.
Mrs. Medema,
Yes.
Mrs. Ebel,
Yes.
Mr. Bergman,
Yes.
Ms. Cosby,
Yes.
motion passes.
Thank you. Moving on to item number 3, it's amendment to the resolution establishing depositories. Suggested motion is to approve and forward to the Board of Commissioners the amendment to the resolution establishing depositories of public monies. Do I have a motion? So moved.
Second.
Is there discussion? See,
Just a question.
question, yes.
Just wondering
Voss?
if we could hear from the treasurer on what the change was for.
Sure. Thank you, Amanda.
You're welcome. So I have 3 brokers that when I purchase instruments. 2 of them have remained the same since I've been in this position. And then we have a new broker through Huntington Trust, Huntington Securities. The broker that we're talking about today has moved from Robert W. Baird to Hilltop Securities. And so she is one of the folks that we have retained. Prior to my having this position, she was here with Treasurer Bradslaw at the time. So she has just moved from firm to firm.
Great.
Any further questions? Seeing none. Right. And this one, should we go to roll call? Sure. All right.
Mr. Moss,
Yes.
Mr. Bergman,
Yes.
Mr. Zylstra,
Yes.
Mr. Bonema,
Yes.
Mrs. Medema,
Yes.
Mrs. Curran,
Yes.
Mrs. Ebel,
Yes.
Mr. Belknap,
Yes.
Mrs. Rhodey,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Thank you. Moving on to action item number 4, it's the early voting agreement. Suggested motion is to approve and forward to the Board of Commissioners an agreement for early voting administrative services and to add 1 full-time equivalent benefited to elections logistics specialist and 1 temporary elections logistics assistant positions. Do I have a motion?
So moved. Second.
And is there discussion, Mr. Roebuck?
Thank you, Madam Chair.
Thank you for the email exchange too. I really appreciate it, Justin.
Happy to talk about that or anything else as well. I do have just a brief presentation to try to catch you guys up. I know we've had conversations over the past couple of months on this. Kind of wanted to talk through that. Thanks, Jordan. Shannon. Sorry, this is really just not going to stay on there, I guess. Sorry, guys.
Can I interject just one comment? And I was trying to look for my email to you. You know, when I think about the election processes, unfortunately, it becomes so personal. And for me, I don't think about it from a personal perspective. My clerks, my county clerk, and then the townships and the city clerks, I think do a fantastic job. It's just making sure that we, guard our election integrity. So when those questions come forward, please don't hear that from a personal perspective and more a process related perspective and how we do it better.
Oh, amen to that. I appreciate that, Madam Chair. And I think, having been in this business for 17 years, I completely agree. I think that obviously this is personal as it's a career for me, but it's also of the highest importance for our public. So, we need these questions and that accountability is really important. So thank you for that.
Thank you.
Let's see if this, it does work. Okay. Yeah, appreciate that. So what I thought I would do is just a brief presentation, kind of walking through the process. Proposal 22-2 that passed in November of last year changed quite a bit of election law, putting a lot of things in our state constitution. And I'm happy to have a conversation about all the other things that it changed, but obviously for our purposes today, just kind of wanted to drill down into some of the specifics on the early voting piece. So essentially, Proposal 2 in 2022 created a right to early voting, in-person voting, in which all voters would have a minimum of 9 days of early voting before every state or federal election. State or federal election is basically any election with a state or federal candidate on the ballot. And this voting process is what we call polling place style. So a lot of folks, when you think of voting absentee, sometimes, people go in to vote when they go into the clerk's office and fill out an absentee ballot. And that is, in a sense, casting your vote early, but you putting that in an envelope, and that vote actually only counts when it's opened on election day by poll workers. So polling place style is really what you think of at the precinct on election day. You're walking in, applying for the ballot, signing the application, getting issued the ballot, and putting it in a tabulator. So that process is what is meant by early voting. Obviously, it's not early reporting. So as with every other early voting state, the process would be that the votes would not be tabulated until the close of polls on election night. The other thing that the proposal did was also created the ability for municipalities to contract with either other municipalities that they are directly physically connected to, or the county for the process of early voting services. So really the burden and the responsibility for early voting was put on municipal governments, the cities and townships in every jurisdiction in the state of Michigan, but allowed them the ability to contract with counties or with each other. So a little bit about PA 81, which is essentially the legislation passed in June of this year that implements early voting. A couple of the specifics there would be requiring the Secretary of State to provide the resources for what we call a vote center model. And those resources would ensure that our voter file remains secure in the environment where a voter could go to early voting and then obviously potentially show up again on election day, show up at another vote center. We have to have the ability in the system to ensure the integrity of one person, one vote, and that directs the Secretary of State to essentially create that, implement that program. Also, the implementing legislation allows municipalities across the state to set their own hours and their own times for early voting up to 29 days. So in other words, a municipality could choose in one neighborhood to say, or one municipality, I should say, we're going to do 20 days of early voting. And then a neighboring municipality could say, we're going to do 9 or 10 or 15. The hours are flexible for each municipality as well. A couple of the other things implementing legislation did, which were very important, prescribing the security measures and the process that have to be maintained when we are maintaining early voting centers. So basically directing election officials to properly secure ballots, tabulators, and other election materials used at the voting sites. Establishing processes for the county and municipal agreements. PA 81 also requires the county clerk to essentially submit the early voting plan in every one of our 83 counties to the Secretary of State. And it also requires a communications plan, because I think a lot of voters, even today, I think if you talk to our average voter out there, I don't know that they really know that this is a thing that's coming. So that communication plan. And well before June of this year, when PA 81 actually passed, we have been working in a process of developing what if this happens. So essentially beginning in October of 2022, prior to the election, we had a conversation, and I know you've heard from a couple of our local clerks here today, but we are in very regular conversation with all 23 of our local jurisdiction clerks. And really that conversation just started with, if this passes, what does this look like for us, for our voters, for our local election administrators, and how do we move forward? And as you can see kind of on the timeline, I won't go through all of this, but we have been developing a process with our input from our local clerks, also great input from a strategic group here comprised of Strategic Impact, Paul Sachs and his whole team, our Fiscal Services Department, Corporation Counsel, the Sheriff's Office, Equalization, other departments, IT that contract with local units of government. And so it's been a broad process. A lot of conversations have been had, and we've greatly appreciated all of the input, including from board leadership as well. Here's where we're at today, essentially talking through this plan. And then obviously the anticipated and the goal would be in October, when the 2024 budget begins, to be able to begin implementing this process. So what does our plan look like? After a lot of collaboration and discussion, we believe the best plan for Ottawa County is to engage the county clerk's office and staff to implement a county-wide early voting system, as well as a voter communication plan. Basically, this would look like a 2-year agreement, which is in front of you, obviously, to establish that process, along with a full-time early voting coordinator. The title of that is Election Logistics Specialist, but I think this is really a critical element of our plan, because we believe we need that expertise here to be able to effectively implement that. Utilizing the vote center model, basically for maximum efficiency and security. So what we're looking at is a plan that encompasses a few strategically and conveniently placed vote centers where any voter within the county can go and have their ballot counted. And so when you look at early voting and how early voting has been implemented in other states, and we've done quite a bit of research and talked to a lot of colleagues on this as well. Obviously, Michigan is a very decentralized state. So we're a state where, you know, the control aspect of our elections rests with our city and township clerks. And the county clerks have certain oversight, obviously, and certain involvement in the process. But we are indeed a very decentralized place to run an election. Early voting occurs mainly across the country in a more centralized community of how elections are administered. So for example, the early voting center is different than your election day polling place, from the sense of when you go to vote on election day, you're walking into a church, a school, maybe in your neighborhood where you're casting a ballot. It's close to home. It is generally small because the size of a precinct is small. In a vote center model, you're looking at voting at a place that is convenient for a lot of people. So it's off of a highway, or it's where, you know, a lot of people are working, a lot of people are shopping or eating out. And it's generally a larger facility and it accommodates more voters. And so we believe that that is the most cost-effective way to implement early voting here as well. And then importantly, this is a cost-sharing collaboration of all 23 of our local jurisdictions. So instead of each jurisdiction paying for the cost of early voting on their own, we are essentially providing the opportunity for each of our jurisdictions to collaborate with that. So here's kind of our projected identified areas, geographic areas where we want to have vote centers located. And these centers are obviously convenient for voters. We want to make sure that they are in population centers. We also feel it's very important to have a location north of the river, as sometimes transportation issues can be challenging for our communities that are in northern Ottawa County as well. And we've had some really great discussions with site locations. Obviously, nothing is confirmed yet because we have not confirmed this plan, but we are definitely looking in those general areas. A little bit on the cost breakdown. Sorry, keep staring at this donut. It looks so good. Hot water. Just kidding. So Ottawa County's cost portion would be the equipment and 50% of the ongoing maintenance of the equipment. So, and this is really in keeping with how we have historically, since 1946, actually, Ottawa County has owned the election equipment. And in our most recent agreement in 2017 with our local units of government, we asked the local units to take on 50% of the ongoing maintenance costs for voting equipment. And so that's kind of where we have started the baseline for this discussion with early voting. And importantly, it also advocates for this early voting coordinator position. Essentially, we would be paying at the county level 75% of their salary in the off year 2 of this agreement. And the reason for that is the bulk of their work on the early voting process is obviously happening in year 1, in the presidential election year in this case. And we feel like that consistency in maintaining a full-time employee is really critical versus trying to go out and hire and seek that talent every few years when it comes to overseeing the system. And so this is essentially our portion of that piece of the cost. Local units are collaborating and consolidating to pay for the material costs of all the vote center operations. 50% of the equipment maintenance, obviously. They are paying 100% of that early voting coordinator salary. We're also paying for 100% of the part-time individual that we've requested in the budget as well. So that part-time position is actually only for year 1 of the agreement, and that's fully covered by the locals. And then all election worker, poll worker, and temporary staff costs as well. The big piece of this that is still kind of an unanswered question for us is the estimated state funding. And we do have a $30 million appropriation that was passed and signed into law by Governor Whitmer in June that essentially allocates grant fundings for every county, predominantly for the use of the essential equipment, which is defined in the grant application, which we've now received. Very excited to report we've at least received the application for grant funds. And we're very anxiously awaiting the formula, which is going to be used to disperse those grant funds. We are told that the formula is, well, actually the legislature told us that the formula is to incentivize county participation in these early vote agreements. And many, many counties, in fact, the vast majority of counties in the state are doing that. So we're waiting to hear exactly what we'll receive, but we estimate, and again, I want to stress that this is an estimate. But we're looking at a $250,000 piece of that funding coming directly from the state. The majority of that funding is going to be to offset, honestly, the county's cost in the election equipment piece of it. And so obviously we are encouraged by that. But I think something that was really important for us as we had these conversations with our locals was we can't wait for the state to do this well. We have to be able to plan and make sure that we have resources from our own communities ready to support what we believe is going to be the best plan for early voting. Because really the biggest ask before you today is this full-time staff person. I say that because we are assuming a majority of our equipment costs are going to be covered by state grant dollars. Really what we are asking for today is for the funding of this full-time staff person, 75% of that funding cost in year 2. And here are some of the real reasons why we think this is important. Having somebody there to essentially establish and secure those locations to ensure that they're meeting the federal and state requirements, negotiating the pricing and ordering all of the material supplies for these early vote center locations, coordinating logistical movement, securing the election equipment itself, making sure that the public testing of that equipment is being done properly and according to statute, creating and maintaining a detailed communication plan for our voters. Very important part of this is the customer service that we're providing to our almost 230,000 registered voters, as well as the training, hiring, and logistical coordination of, we estimate about 56 election workers that it's going to take to maintain these early voting centers across those 3 elections next year. And we have spent a lot of time detailing and thinking about what is this person going to do in their downtime, you know, as we roll into really essentially what we used to call a non-election year, which there really is no such thing, but it's sort of a slower time. And it's a time we use to prepare essentially for the larger election. So this person will be responsible for maintaining our portion of the county voter file in accordance with the county death records. So we had some legislation that passed this past cycle, which basically gave us much better reach into ensuring that the death record information coming from the county clerk's office would allow us to immediately flag for removal voters who are deceased. Another thing that we've been in conversation with our local clerks on is the NCOA list, which is a national change of address list. Really, really important for maintaining the quality of the voter file. And this is not a requirement across the state of Michigan. It's completely optional for election officials to use the NCOA. We felt that it was very important in 2020 when the governor mandated that applications for a ballot be mailed to every single registered voter. We had a conversation with the Secretary of State's office and said, you know what, Ottawa County is going to do this ourselves. And we ran the NCOA list and removed over 5,000 names from that application pool. So this is really an important piece of maintaining a great voter file across the county. And we believe that this position can definitely assist with that process as well. So just kind of in summary, these are really the specific reasons why we believe this is the best fit and the right plan for Ottawa County. Uniformity is really important when it comes to security in the process, and implementation of a uniform process with uniform security requirements, uniform tools. So we have all of the same stuff that we're training all of the same people consistently on to do the right things. Watermarking of ballots, which I completely agree. Commissioner Cosby is a really important function of this. We have been working on this process for about 4 months now because the way that our ballots are issued is going to change a little bit with early voting. So we used to require in the state of Michigan numbered stubs to be attached to each ballot, which is really an accounting best practice that's used by a handful of 50 states, but certainly not the majority. So Michigan's moving away from that process. And we believe that watermarking ballots is just one additional security tool that's going to be really important in the implementation of early voting as well. Our agreement calls for on-site supervision every day by local clerks. And I really want to stress the importance of that piece of it. That's something that our local clerks have advocated for, and it's something that I've been a really strong advocate for in these agreements as well. Basically, that means that the election process is still being overseen by the people who are in charge of overseeing our local elections. And we have a very close-knit and tight relationship with them through the agreement, but also just through our relations that we have normally. Minimizing potential disruption. This is one thing that I believe that early voting is certainly a benefit to all election administrators, and that is the risk mitigation factor. It becomes a lot harder to disrupt an election when you have multiple days in which you would have to disrupt an election. So, you know, one common threat that we plan for as election administrators, along with our law enforcement, is an election day disruption, something that would shut down a polling location, something that would prevent people from casting a ballot, is a serious security issue. And early voting mitigates that. I mean, it helps that process to allow for people a better risk mitigation factor. So there are more places you can go. If something happens at one site, you can go to that site on a different day, or you can go to another site. Live voter data. We're already using tools that ensure, for example, with same-day registration, that a voter cannot walk into a location and register on the same day and then do that again somewhere else. So this enhancement of that tool for early voting is really going to help Michigan's election process, and we believe that it is definitely a secure way of doing it. Customer focused. I think, you know, something that, you know, one of my mentors in the election space and my former boss, Secretary Land, always taught me is that we're always balancing the security and the customer service of elections, right? Elections is a customer service business. We are here to serve our customers, and we believe that this is a really quality customer service plan for our voters. The convenience of a vote center model is big, but also the whole county collaboration really means that we have this uniformity in the days and times. We don't have people who are saying, well, my neighbor lives on the other side of 96th Avenue and he can vote for 10 more days than I can. Or the hours in one community might be convenient for people who work during the day, and the hours in another community are not. This is a uniform plan, and it's also allowing us to clearly and consistently communicate that message to our voters, which is really important as well. And finally, as Clerk Hansen from Allendale mentioned, this is a cost-effective plan. I think this is probably the biggest factor in realizing for me. Really, I had two questions for our clerks when this happened. One is, what can I do to keep you from retiring? Truly, I mean, this is something that is a huge burden or a huge responsibility and a huge cost on our local units. And experience plays into the security and integrity of our elections. And we need to have a community of people who are dedicated and have knowledge and experience and want to do this. So the other question was, how much can we save by doing something like this? And, you know, our conservative estimates, you know, look at us saving roughly $600,000 in the first year of implementation, in the first election year. When you think about 23 jurisdictions hiring all of the election workers necessary to run a minimum of 9 days, 8 hours per day for 3 elections next year, all of the equipment needs, all of the things that would have to happen, it's a true, it's a win-win for our voters, I think, when it comes to the security, convenience, and the cost savings. And again, these numbers are not taking in the state's funding piece. We really wanted to present to you essentially a worst case scenario, and that's what you have in the budget documents in front of you. This is kind of the, you know, the plan that we've planned for, where the state doesn't come in to provide resources, and we know that they will. So that is it. I apologize for going a little long, but I'm happy to answer any questions you have, any concerns at all.
Commissioner Moss.
Thank you. Thank you, Justin. Couple questions. If there were unexpected costs, you walk us through what might happen if maybe some of the state funding doesn't come in, or
Yeah.
if there's just something unexpected.
Great question. So really the early voting interlocal agreements provide for that with the unexpected costs. Essentially, those costs would be divided amongst the local units in the agreement. So, a county is not really a vendor for the purposes of, we're not making any money on this, and we're really not spending any more than what we've committed in terms of this FTE position and the equipment. And so what that essentially looks like is a cost increase would be shared among 23 local units, which again is an advantage in the sense that, for example, if equipment were to be mandated, additional equipment, and if we had 23 local units, that would be a much more significant cost than if we're splitting that up over 23 units. So, but ultimately, I think it's section H of the interlocal agreement that you have in the packet kind of details the process for what that looks like. One stipulation in the agreement as well is if our projected costs for staffing increase, we're required to notify the clerks in writing of that. So that's our piece of it, right? If we somehow have a staff change that would require an increase. The budgeted amount, by the way, is for the full 7th step, essentially. And so we don't anticipate needing that much. So we do have some flexibility there.
Thank you. I had a couple more questions, if that's okay. You had mentioned the numbered stubs being removed. Could you talk about that just a little bit more?
Yeah. So along with not in the implementing legislation of PA 81, but there was additional bill that passed, which essentially removed the stub numbering process from Michigan's ballots. And so what we essentially have with early voting is multiple places where ballots are being cast and multiple ways in which the ballots are being cast. In other words, because the legislation also allows for an absentee voter to walk into a precinct on election day or an early voting center and cast their absentee ballot that was issued to them. And so the stub numbering at some point becomes more of a challenge to administer from the accounting perspective when you have multiple ballots from multiple places. So
why was it used in the past?
Essentially, and again, Michigan, I want to say there's like 13 US states. We did a little bit of research a couple of months ago, and I can get that to you, but I think there are about 13 US states that use it, and it is an accounting method. So for example, it's easier to account. Now the numbered stubs are on your ballot when you receive it, but they're removed from your ballot when it's cast because we don't want your ballot to be identifiable to you. So in other words, you're issued a voter number when you walk into the precinct, and also a ballot number. So when you're about to cast your vote, your ballot number is essentially removed from your stub. But what it does help is in the accounting of the number of voters in the precinct for the election workers. And so we think it's an advantage. I personally think it's an advantage. And so it's something we're going to have to work really hard to ensure that our training processes are effective. I think, and again, that helps us with watermarking helps identify a ballot as a legitimate ballot, right? And it helps the voter to know when they see a watermark. It helps us in the accounting and the auditing and the certification process later. But essentially the numbered stub doesn't help any longer once it's removed from your ballot. If that makes sense. I mean, it kind of helps on the front end, but not on the back end.
So it sounds like the state has removed an accounting feature that used to help local clerks track voters.
Correct. Or at least track the number of voters. Exactly.
Yeah. Okay, that sounds concerning to me. Another question I have is related to the voter file and just who has access to it. You mentioned the voter file and how that works.
Yeah, definitely. So our qualified voter file is administered by law by the Secretary of State's office, and it is connected to and tied to the driver license file, which is obviously also administered by the Secretary of State's office. And that's been that way since 1978. We call that the motor voter rules that really made Michigan one of the more advanced states in terms of tracking voter file. When we still have states in the US right now where the DMV and other state agencies and the voter file are completely disconnected. So it really is an advantage because when you move, you're likely to change your driver's license number, but I don't know about you, a lot of people are not likely to call their local clerk and say, oh, by the way, I moved, make sure you, so that is helpful. So who has access to it? The file itself is administered by the Secretary of State and by our local clerks. So it's kind of an interesting bifurcation. The county has access to the QVF, but does not have any power or authority to change any file. So even with the death records, for example, my role in that process is notifying a local clerk immediately that someone has been deceased so that they can remove it. So it's the Secretary of State on the top end and the local clerk on the bottom end, if you will, but they are actually, the local clerk's actually the registration official.
Okay. One more question, really. Actually, I'd like to make a motion to add 8 words to the contract. And that would be under scope of services, page 2. And if you're looking at the packet, it's page 49. And the motion would be to add the words subject to approval by the Board of Commissioners in the first sentence of scope of services so that it reads, the county clerk, through its designated representative, agrees to administer, according to the Constitution and laws of the state of Michigan, 4 early voting sites, subject to approval by the Board of Commissioners for each statewide and federal election, and so on.
So is your motion to amend this? Do
So that's my motion.
we have support?
So, Mr. Chair, oh, sorry.
Sorry. Support. Discussion. Go ahead, Mr. Roebuck.
Yeah, I can provide you with the statute, but the statute actually specifically outlines the scope of the Board of Commissioners authority with regard to early voting processes, and actually vests authority of the board with the funding piece and authority of the election commission with some of the other implementation pieces, but I can definitely provide that information too.
So are you saying that it would not be possible to have the board approve the locations of these?
The locations are specified in statute that they be approved by the election commission of the county.
Okay, then I would like to,
When we're not accepting recall petitions.
then I'll withdraw my motion. And thank the election commission board for handling that process.
Thank you. Mr. Bergman?
Mr. Roebuck. So help me understand the 9 days in the four locations. Currently, you have a staff of I don't know exactly how many at each one of those polling stations, but it's at least 4 or 5 people, correct? Usually.
Correct.
So what do you see in those 9 days? And here's the reason I'm asking this is because sometimes I know it's been difficult to find those 5 people, because certainly it's usually people that are free to do this. I mean, they're retired people usually, right? So how difficult is it going to be to find people to do those 9 days? And how many people are you going to need in each one of those 4 locations?
Definitely a great question, and one that we have, certainly asked ourselves. One of the encouraging things that I see is that we've had a lot of people step up and ask and volunteer, and we certainly will be taking applications and that process. But one of the things that's specified in the agreement is that, and actually stipulated in the statute, is that the local clerks provide us with the contact information of the workers that they hire, So we really do see this as a collaboration with our locals. And ultimately, like the people who have experience as election workers, those are the people we want to be in this, especially in the first year of operation. We've had a really good response just anecdotally so far. We haven't officially or formally done anything, obviously, because of the agreements, but anecdotally, and just as we've asked, a lot of people have been interested to step up and to do that. And you're right, we're the agreements call for roughly 10 individuals in a voting center at a time. We assume, based on data from other states, when you look at how other states vote, particularly states that have absentee voting widespread like Michigan does, we see kind of a third sort of process. So when you look at a third of people voting on election day in their precinct, just like they always did, third of people using absentee and a third voting in an early vote center. So that's where our numbers are based, and that's why we've done quite a bit of modeling using those turnout statistics, because obviously we have no other data. We're definitely planning to collect a lot of data, no matter how we do early voting, to gauge for the future. But that's where we got those numbers.
Thank you.
Yeah.
Commissioner Miedema.
Morning. Thanks for being here.
Yeah.
Few questions I have. So the first one, how is the number 4 selected for locations? Why not 3?
So we originally had a model that called for 3 locations. There were a couple of factors there. When you look at the data in terms of voter turnout is based on the more populated regions of the county. Obviously, the areas where the most voter registration are the areas where the most people are. So we looked at Georgetown Township and the Hudsonville area as a big section there, as well as the Holland area, the region around Holland Park Township, Holland Township, and then the Grand Haven area. And so as we looked at those numbers initially, as we were modeling out for turnout, we realized that in a full-on highest ever volume, actual numbers, that was going to be busy. Those centers were going to be really busy, as well as the fact that we were hearing from folks, in our conversations and our, focus groups and our clerks saying, we need something, somebody in Spring Lake or Polkton Township, to drive to Grand Haven, that's not convenient, right? That's not a really convenient spot. So I think it really came strongly from the communities that were north of the river saying like, hey guys, we're kind of feeling left out of this equation. And in factoring in, adjusting some of those numbers, I think that will help in the other centers as well.
Another question. So I've observed these conversations taking place at the different township board meetings. The city councils, Renee did a great job at the city council presenting, but I feel like I heard one thing differently there and here. So I'm just asking for clarification. So
Yeah.
Once a constituent decides they want to vote at a certain location, I've been heard it both ways. I think I heard today you mentioned that they could go to anyone, but I heard when I was at Coopersville, it was stated you have to previously select which place you are going to go vote. And then that will stay the same over the entire 2 years.
No, definitely not. So obviously, once you've selected that place in that election, you're not going anywhere else once you voted. But the vote center model allows somebody, so, if you work in Coopersville and maybe the north of the river location might be closer to work, you could vote there. And maybe you live in Blendon Township or something. So you have the option of voting in any location, but that changes for every election, essentially. Does that make sense?
The person that's voting, will they need to let that jurisdiction know they're voting there ahead of time?
No, so that's where the live database comes into play, where essentially within the vote center, and we use this model basically with the voter registration that I was talking about, same day registration, where our clerks can see when they pull up your name on election day, if you're in front of them to register to vote, they can see the last place you registered when that was. And so essentially, effectively, on election day, for example, if somebody lives in Hudsonville or Blendon Township, they voted in Coopersville 3 days ago, they are going to show up on that election day register as having voted.
Question. I have some more thoughts that I'm thinking through. I guess I'm thinking communication. So I still have questions about the whole process.
For sure.
How will this be communicated with all citizens in Ottawa County?
Yeah, no, very, very great question. So we're working within the limited scope of the budget that we've presented on a communication plan that will use any available tool. One of the real communication tools that I think will be at our disposal are the city and township newsletters that are provided by almost every jurisdiction. We want to make sure that those local clerks are partnering with us and collaborating with us and getting that word out to their residents. This is how this process works. If you choose to vote early, this is how, and this is where, and this is when. As well as using our own communication tools available to us and making sure that we're, communicating regularly with the media, with any other interest group within the county, and making sure that all parties know, how this is going to be rolled out. And we can definitely talk more about that because I think it's, it's an important part of the development.
Other languages besides English, do you know? Like as we communicate?
Good question. So there's current legislation that could change this right now, but currently and in the past, so the federal requirement under the NVRA, the National Voter Rights Act, requires us to look at the census population of every community. And if the census population is over 30% of a different language speaking, then we are actually required by the federal government to supply ballots as well as any other election, related information in that language. So we do not do that in communities that are under the 30%, because at that point, we're really basically using our own judgment as to what the criteria are. And that can be a challenging gray area, opening ourselves up essentially to the potential for, litigation on the factors of, how do we do that? So we have a couple communities that are actually very close. Olive Township in the last census was, I think, at 28% Spanish speaking in the census. So currently, I can tell you that our plan is not necessarily to provide, we'll always provide language services if somebody directly calls and asks. And in the voting precinct, one of the things that we say, and one of the ways that we train, if someone comes to the voting precinct and they cannot speak the language well, the federal and state law allow for them to bring in someone who can assist them. That person has to be noted in the poll book. We have to ask them specific questions. Can't be their boss, can't be their union representative. So we have ways of mitigating that, but it is a communication challenge for sure.
How many of the jurisdictions so far have said they want to have the county participation?
So we started in April with letters of intent. We received 23 non-binding letters of intent from all 23 local clerks. As of today, I believe we have 4 jurisdictions that have not passed the agreement. So they are very anxious essentially to get working in this collaboration. And those 4 are slated to. So I think there are a couple in Wright Township, Talmadge Township did. So basically about 85% of our jurisdictions have passed it.
Couple questions for you. Thank you for a very comprehensive work plan. Did you benchmark this plan from any other counties or states that use centralized voting?
So we definitely had a great working group of local clerks, part of our clerk leadership of the Clerk Association, as well as some others representing big and small jurisdictions here in Ottawa. They reached out to a number of communities across the state and across the country. I've been talking with colleagues in North Carolina, Tennessee, Texas, other places that have early voting. I would say we've done more probably research outside of Michigan. Obviously, it's new to everybody in Michigan. Kind of putting these things together. And yeah, really ultimately, this plan is based off of sort of best practice advice, but also off of our own sense of where we feel like the community needs, the needs of this community. I will say that in talking to many colleagues from across the state, we are all sort of in a very challenging place because this is a very tight time frame. And we began planning well before the legislation was written, implementing legislation was written. I think the Secretary of State released a draft early voting agreement sometime last month. So at that point, we had already had our early voting agreement approved by corporate council and looked at by multiple municipalities. So even though it's tight for us, I feel like we are in such a great position because of the leadership of our clerks.
So have you flowed this whole, the 9-day plan to see for failure modes and mitigating for things like weights or machine functionality?
Yeah,
security?
great question. And I know, I mean, I think you have a lot of process experience as well, and some of the tools used to really outline, a process like this and implementation. And I would say we have done some of that. We've got a lot more to do. We've got a lot to do in the next 6 months, essentially. One of those things in particular, developing safety plans, the security plans for the site locations, ensuring that we have that documented. Line mitigation has been something that I've been in various work groups that have looked at line, mitigation and certain tools for analyzing that. And I think we have a pretty good handle on that, but I would like to, I'm anxious to, sort of get the staff on board and in place and the leadership that we know we have essentially so that we can begin a little bit more of that detail. That makes sense.
Absolutely. Any further questions? Commissioner Bonema?
Justin, thank you for being here today. I know this has been a challenging time for you, as this was something that was not on the radar last year. And like you said, the time period for which you have to accomplish all of this is quite short, and that just adds to the chaos of actually putting and implementing every step in place. But I can tell you and your staff have put an enormous amount of work into this presentation that we saw today. That was fantastic. I really appreciated that effort. Two things. One, well, let me just say, this is going to be a learning experience for your department, right? This is the first time that's ever been done. So one request that I would have for you is to come back and tell us, after 6 months, after we do this, what you learned, anything that we can implement, that we can support you and your department to make sure that we have safe and secure elections going forward. If there's any weaknesses or things that you noticed along the way that we can improve upon. But just let us know that, or let us know how we can better partner with you to secure our elections with this new standard being put in place. The second thing that I want to let citizens know is that these locations will be open for 8 hours a day. And that's great. Most days it'll be open from 7 a.m. to 3 p.m. with 2 days being opened from 11 a.m. to 7 p.m. So if you work certain shifts, you're going to want to keep an eye out for the days that your location might be open, because we certainly want to get the vote out and make sure that everybody knows when they can vote, so their vote can be counted.
Yeah, thank you for that. That absolutely makes sense. And we're anxious to gather data and pull together information that we can glean from this. So I'll be happy to report back in any way.
Thank you.
Commissioner Ebel?
Yes, I had a few constituents wanted me to ask a couple of questions. So they want a better, I guess they want you to walk through the process of watermarking and how does that work and how do you know which ones are not? Or how would you, I don't know whether you have the answer or not at this point, but how would you know which ones are, which ones aren't, and which ones are, I don't know, lack of a better word, the fake ones. And so how would that all work?
Yeah, I mean, the nice part about a watermark is there's such an easily identifiable thing, right? You know, when you hold up $100 bill, hopefully you can see the Ben Franklin image or whatever in the, I don't have a whole lot of $100 bills, but you know, I've heard that. But you know, the benefit of watermarking is that anybody and everybody can see that.
Okay.
And that's a technology that's not been used in Michigan and is currently not used by any jurisdiction in the state of Michigan. And we have been pushing over the past several months over conversations with Secretary of State leadership, as well as my colleagues, frankly, the counties, you know, that is one of the county responsibilities is the printing of ballots. And so my colleagues on the county clerk side, we've had some really good conversations with our vendor, which is Hart InterCivic, which is our election equipment vendor. California, ironically, on the cutting edge of watermarking. So a lot of counties in California utilize watermarking. It's a more expensive process. We've been in a number of conversations, and I was mentioning this to Commissioner Cosby as well, but a number of conversations with our current print vendor that we use, which is a Michigan company we've used for a couple of decades now. And they've printed millions and millions of ballots over the past several years. And they have been having difficulty acquiring the stock to print that on. So when, you know, when they purchase paper, they're purchasing it in massive rolls, right, from a paper supplier, essentially in Minnesota. And so we're looking now, just kind of shifting our vendors that they use. And our hope is that our ballots can still be printed by the same print vendor. That's really important, that the quality that they have used and stood by for years and years, the print quality of the ballots is really important. But we may be looking at supplying that paper elsewhere in order to achieve the watermarking. So it doesn't do anything different on the ballots other than identify. And I think that would be something we want to make the public very aware of, because it could easily be something you would miss. But if you're holding it up to the light, it should say official ballot. Is that a process they're going to be doing or does the machine identify it, or?
Yeah, it's really the machine would identify. The machine has specific requirements as to the weight of the paper, but not the watermark on the paper. So the machine is only programmed to read ballots for which it has the specific, barcode on the side for. But I don't think a machine would be able to identify a watermark versus a non-watermark. It would be one of those human readable checks and balances essentially on the machine.
So will you be doing like an audit of so many at the end, or?
We do conduct audits after every election. So we audit 10% essentially of our voting precincts at random. And those audits include a hand count, a hand tally of the total number of ballots, and then a specific hand count of a race within the precinct to ensure the accuracy of the voting equipment. So yeah, we would definitely continue that for early voting as well as the precincts.
Okay, can I, a couple more questions? For those that I think I heard you say that that people can register to vote that day.
Correct.
And then, so can you explain that process of how, say, that person registers that day, but then the machine, will that automatically go through all the automatically, in other words, are they all connected where it'll show up over there? But what if theirs went down in another location, their computer went down for some crazy reason, and then they have to go?
Good question.
So what's the process to help that?
So we've had same day registration, excuse me, in Michigan for since 2018, which was the last ballot amendment that passed. Proposal 3 allow for same day registration. So how that works is when you go, it's at your local clerk's office. So you are going to your city or your township clerk's office to register. You have to show an ID, a photo ID with the address that matches the address that you're purporting to register at. So it's actually a pretty high bar. To make sure that, okay, this address matches the physical ID that I'm seeing in front of me.
But then the local clerk goes through this process of entering your driver license or state ID number, which identifies you as the voter in the system and shows where you have registered, if any, in the past. And then they actually issue you a receipt. So that receipt is signed by the local clerk, and it's evidence of the fact that you did register on that day. And so in the event that an early voting location, for example, a voter would have to bring that receipt to the early voting center. And one of the things that we had the option to do that was in the implementing legislation, but we chose not to collectively as a group, and I'm very supportive of this. The early vote centers had the option to also be same-day registration centers, which essentially would allow each of the centers to register or change somebody's voter registration on site. And we just felt like, local clerks are responsible for the voter rolls in Ottawa County and in Michigan. And so we want that to continually be a local clerk function. We want that, security element there where someone goes into the local clerk's office, they do that verification piece. And so that's a part of our agreement as well.
Couple more questions.
Sure.
So hopefully not. So I know that those places have different, there's going to be 4 locations. And when they go in to do early voting, and then they're only open for so many hours a day, how are those going to be secured? The ones that have been the paper.
Sure. Yeah. Great question. This is something we've been spending a lot of time thinking about. So the process would involve the precinct workers sealing and securing at the end of every single day the ballots that were cast along with the ballots that have not been cast. And those are sealed in separate compartments, separate approved ballot containers. The seal numbers have to be stored in separate places. And we've looked into the material. We have a couple of really great vendors that we've been looking at for basically steel security cages that would allow for everything that is required to be under seal placed in one locked security cage. That security cage would be locked, would be sealed. And the seal number obviously would be a tamper evidence seal that we could identify the next day. And then that whole unit would be rolled into a secured and locked room. So we've got a number of checks and balances in that process that would be followed by, again, the local clerk every day on site who is essentially the site supervisor for the day, as well as the election workers. So that was one of the things we felt really important to make sure we had consistency in. Everyone's doing the same thing, following the same procedure.
Will there be security covering that, wherever they're placed, watching that, or cameras or anything, making sure nobody breaks in?
Yeah, I think
They have very specific questions.
No, I think those are good questions for sure. And an ideal site location would absolutely have security footage. That's really important. That's footage that is, on each one of our ballot drop boxes now, for example, is required to have that footage. So we would absolutely want that. It's not a requirement currently under the statute, but that doesn't mean that's not something that we would focus on particularly, because I think that obviously helps in a number of different ways. If something were to happen, we would have that evidence there. And again, that's why part of our goal in having 4 locations instead of 23 or more is the ability to kind of lock those sites down and make sure that we have that security there.
One more question. Of course, there's a lot of, especially in the 2020 elections, there was a lot of concerns. The person that I voted for, I want to make sure that that was tracked, and I did get. So if I voted for a certain candidate, I want to make sure that, how can I go about checking to see whether or not my vote was actually cast for that particular politician or person who was running? So I don't know whether there's a way to address that question or not.
Yeah, I mean, this is a conversation I have with a lot of folks all the time. And I think what's really important to note is that because of the secret ballot, we do not track how individuals vote. And I totally understand the logic, right, of saying,
Yeah,
well,
the
I
voter
want
wants
to
to
know.
The voter wants to check to see whether or not
Yeah.
whoever they voted for, how, is there a process for that, for a voter to check to see whether they voted?
There absolutely is. And I would encourage them to attend one of our audits. We continually ask people to show up at these public audits because it's so important. In fact, we were doing them publicly before it was required to be public. That's where we open the ballot container and we count every ballot and we ensure that the number of ballots matches the number of voters and that the number of the total votes cast for individual candidates match what the machine said. Right. So we're doing a multitude of checks and balances in the process. But I also believe it's very important for me not to know how you voted.
Yeah, but I think the voter wants to know, but they want to make sure that who they voted for actually is counted. So.
No, I completely agree with that. And I think that's an important piece, right, of our auditing and certification and canvassing process.
Thank you.
Makes sense.
Commissioner Curran?
Thank you. I just wanted to thank Justin for coming in today. I wanted to thank you for your leadership. The fact that you were able to get 24 municipalities and their local clerks to come and support for the most part, and a few more left. I'm so impressed with the job you do, especially in light of, what's happened over the last couple of years with our election process. So I just wanted to thank your team, and, put out a word of support.
Appreciate that.
You
We
should
live in a
take
great
donut.
place. They do smell
Yeah,
pretty
you
good.
deserve it.
Justin, I'm just, two more things. Hours of operation, how was that determined?
Good question. So that was basically, I would say a vote of the Clerks Association. When we took a look at how, obviously we needed to have the flexibility in hours for our voters with different days, availability on weekends, mandatory in the Constitution, but also evening hours. So that was not my decision. That was actually kind of this collective decision of our local clerks as to what that best looked like.
Yeah, because most voting doesn't occur before work and after work. I mean, the middle of the day is usually kind of your quiet time.
Correct. Yeah.
So,
Yep. So we have those 7
2
a.m.
days, yeah, communication is going to be so imperative with fluctuating hours. Another
Yeah.
thought that I had to the approximate $600,000 savings that you have,
Yeah.
kind of estimated. Good news is then, with this new position, logistics position, maybe it'll pay for itself.
Amen to that. I mean, I think that's definitely a positive there. And I think, it's certainly I want to recognize the leadership of the board today and whatever decision you make. I think, we are putting our money essentially where our mouth is and saying like, we're supporting our local municipalities. We don't have to do this. We don't have to have a full-time position that we're helping to pay for. But I do believe it's the right thing to do. And I think it's the most effective thing. And I do agree. It's gonna save money.
Difficult logistics, to say the least, over 9 days of voting.
Yeah.
Oh, Commissioner Belknap?
Hi, Justin. Just had a couple questions. In the conversation about the watermark ballots, the ID requirements, that information I didn't see in this agreement. Will there be other, I guess, agreements forthcoming that maybe provide a little bit more specificity to how this operation is going to be kind of rolled out? Because in some ways, the security issue, I mean, I think a lot of people are going to, question, how have we thought all of these different scenarios through? And I just didn't know if at another date there would be more of that sort of coming together and another opportunity for, okay, because right now this is a plan of action. You're going to navigate through this. There may be some things that, you mentioned difficulty, maybe getting paper, how we navigate that. I guess maybe this is more of a request, as we
navigate
Yeah.
this time, that we kind of continue these touch points, how we're moving along.
Absolutely.
How do we inform our constituents of, these situations? I know the newsletters and things like that are great. And then just lastly, kind of a funny question, because I do know that, throughout the county, there's multiple precincts, and, a township clerk may have multiple locations where voting's taking place.
Yeah.
Have we ever had where, with the 4 potential locations, in some ways, does that, because I saw on the map, one of those look like where I have been voting, the last 10 years in
Mhm.
Grand Haven Township. Does the Grand Haven Township clerk have more responsibility over securing the site versus, the Robinson Township clerk who,
Yeah.
okay, it's outside of my jurisdiction? Is there any comments on that or thought to?
Yeah, no, those are all great questions. I think, I guess to speak to the last first, the the location of the sites is going to be important for a lot of factors. And we have actually looked at some municipal buildings as well. Really, the statute requires it to be a 501 organization. And that has universally been the case with polling locations as well. Unless there is no other available option, statute doesn't really give us a very good definition as to what that would look like. But we are proceeding with saying these need to be, my ideal location, honestly, would be a church with an outside gym, like a facility that's separate from the church, because we have 2 Sundays, right? We're have to be available. And so we've had some great conversations with local churches that might fit that bill. And obviously, if we receive board approval, we'll be able to have much better conversations, I think.
Mm-hmm.
But so the goal would be possibly using a municipal building, but frankly, most of our municipal polling locations we use now are either too small because they're precinct based, or they might be big enough, but they're churches. And so the difficulty, 60% of our polling locations are in churches in Ottawa County. And none in schools. We eliminated a polling location in schools as a security best practice, really, with our sheriff's department in 2009 and 10. So no, I don't think a local clerk would necessarily bear more brunt of responsibility. We essentially in the agreement are taking on that role, that responsibility. Obviously, the site supervisor every day is going to be a local clerk as well. So that person would be taking a little bit more responsibility on that day. The other question, so that any statutory requirement in terms of ID or how voters are processed, anything that's spelled out specifically in Michigan election law is not really a part of the agreement. The watermarking of ballots was definitely a discussion going into these agreements, which were finalized in May and June, basically. And at that point, I was cautious to put it in the agreement if we could not have a guarantee of the availability of the watermarked paper. So right now we're in discussions where it's looking like we can definitely secure enough watermarked paper for the early voting centers. So in those early voting centers, we'll have the ability to have watermarked ballots. I'm also concerned about the inequity issue, right, of having watermarked ballots in one place and not in another. So that's been, and I know Administrator Gibbs and I've had conversations about this as well as Commissioner Cosby and I too. We want to make sure to secure that, and we're working hard to do that, but we didn't want to limit ourselves somehow in the agreement. On the touch points issue, 100%, I think it's going to be really important. And I don't know, a lot of times I like to email you guys. I don't know if that's a good way for you to receive, direct communication from me and us on this, but I don't want to overload you, but I'm all about communicating this. And, in your individual constituencies, this is really affecting every one of your voters as well. And so we want to make sure that you have the right and the accurate and up-to-date information. And I'm happy to do that.
Do you have an ideal candidate in mind, or do you have a candidate in mind for either of these positions?
Yeah, another really good question. My ideal candidate would be a local clerk.
Excuse me, sorry. Yeah, I mean, really and truly somebody who has experience in running and managing precincts and hiring election workers. You know, so we're definitely seeking that kind of candidate. We don't have a specific candidate yet. We've had some good conversations, but yeah, we'll definitely, you know, if things move forward, keep you updated on that process too.
This gives you an opportunity to recruit
Yeah, there you
here
go.
at the committee. Yeah. Are there further questions? Commissioner Moss?
Really quick, just wanted to mention the watermark conversation has been going on for many months, to my knowledge. So it's been a long running process. So thank you for engaging in that.
Yeah, absolutely.
Just curious, what would happen if there wasn't enough paper, like emergency situation? I'm just curious.
Well, that's a great question. Hopefully one that I never really have to actually encounter,
Right.
but we have had, you know, in the last cycle in 2021, we had significant paper shortages kind of out of the supply chain issues with COVID. We purchased all of our ballot stock in March of 2021 for 22. So we basically, and this is why I think relationships with our vendors are so important as well. Our print vendor, Printing Systems, contacted us and said, look, I'm a little nervous, but we have the supply now. Are you willing to do that? And we absolutely jumped on that. So we're comfortable, and we're very comfortable now with the supply chain where it's at with our regular ballots. I think the biggest question would be the cost factor, right? Of you know, if we were really in a crunch situation and we had to have paper. But we've been a part of a lot of conversations, including with the Homeland Security last cycle in 22 on ballot shortages. And to my knowledge, I don't think anyone in the country actually had that push come to shove moment.
That's great to hear. Thank you.
Actually, Arizona did, I believe. I think they had to shut down voting centers.
Yeah, I know they had
I think I'm
some
accurate.
printing issues
Yeah.
that caused early voting challenges at certain centers, but yeah, it's a big deal.
And then the 8x5x11 piece of paper, one of our constituents just talked about passing through a tabulator, or?
Yeah, so that information was not exactly correct, and I'm happy to talk to Ms. White more thoroughly about that process for sure. But so we use 8.5x11 ballot stock in our printers. In fact, the May election was printed on that 8.5x11 ballot stock, but we are required by law even now to have certain paper requirements in terms of the quality and the thickness of the paper. But again, that watermarking isn't, you know, I mean, it could technically be a piece of paper of that same quality, but not used. The print, there are a number of identification marks on each ballot in each precinct that the equipment knows, and it has to count only what is programmed to count in those precincts. And actually our new equipment is far more secure in that way than our pre-existing equipment prior to 2017 was. So I think we've moved in the right direction on that, but I would like to continue moving in the right direction on that.
Thank you. Any other questions? We should have given you a chair.
Oh, I'm good.
Okay. All right. So the motion is
You guys.
to approve and forward to the Board of Commissioners an agreement for early voting administrative services and add 1.0 FTE full-time benefited election logistics specialist and 1 temporary election logistics assistant position. So I'll go ahead and go to vote.
I'll make that motion.
Oh, sorry. Yeah, I was just repeating it because it's been a while.
Okay, all
So thank
All right.
you.
Mr. Bonema,
Yes.
Mrs. Ebel. Yes. Mr. Bergman,
Yes.
Mrs. Medema,
Yes.
Mr. Moss,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Curran,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Oh, okay. Looks like we're going to take a 10-minute break. We'll come back at 12:15. start back after recess here. I think we're on action item number 5. And it's a contract for AS 400 support services. The suggested motion is to approve and forward to the Board of Commissioners a contract to support aging software to ensure compatibility issues or vulnerabilities are promptly addressed and resolved by the software vendor, helping to maintain the software's functionality and security.
I'll make that motion. Support.
And discussion. Paul, you can go ahead. Good afternoon.
I never did well after recess.
I know, tired.
This is not as interesting as Justin's discussion.
Uh,
So this item supports professional services to help support our AS 400 environment, a computing environment that supports court case management right now. The courts are in the process of migrating to a new platform, in which case at the end, after they've done that, we won't need to support the AS 400, and this contract, which is not to exceed, could be terminated at any point. We just don't have a firm fixed date on that yet. It also is supported. It's been used for this platform has been used for about 20 years, a couple of decades, and supported by Harold Harper for a couple of decades. But Harold has decided he's going to retire at the end of the month. So we felt it was best to engage professional services for this because it's going to be hopefully very short-lived.
Are there questions? No. All right. Do you have an approximate idea how long the contract would be for?
This covers it for the entire year,
For the year? Okay.
but I'm not anticipating us, needing it for the entire year.
So you'll be able to shut that off
Correct.
as needed.
Yep.
Perfect. All right.
Okay.
Thank you.
Thank you.
Thank you. Hey, let's go to a vote.
Mr. Belknap,
Yes.
Mrs. Curran,
Yes.
Mrs. Medema,
Yes.
Mr. Moss,
Yes.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Ebel,
Yes.
Ms. Cosby.
Yes,
Motion passes.
thank you. Moving on to action item 6, and it looks like 6, 7, and 8 are very similar. And it's a contract to provide weatherization services for Ottawa County Community Action Agency. The suggested motion is to approve and forward to the Board of Commissioners the contract with Sales, Heating, and Cooling to provide weatherization services for Ottawa County Community Action Agency for the period of October 1st, 2023 through September 30th, 2025. Do I have a motion?
So move.
Second.
Is there discussion? We'll keep you up here for the 3 if there's discussion.
Good morning.
Good morning.
So I'm not sure exactly what questions you have, but maybe it'd be helpful just to kind of summarize really the next 3 agenda items. So we have a large weatherization program, which requires the work of multiple contractors for mechanical work, so like heating and cooling businesses, and then kind of general contractor work to do things like weather stripping, insulation, and those types of things. So this particular contract is with Sales, Heating, and Cooling. We have worked with them for a number of years. So this is essentially kind of renewing this contract for another 2 years with them. They've done fantastic work for us. And again, doing things like new water heaters, furnaces, other heating and cooling items. So yeah, that essentially is what it is. It goes through all of our contracts for weatherization go through the RFP process. So we work very closely with fiscal services and the purchasing department just to make sure that we're thoroughly vetting these vendors and making sure that they have competitive and fair pricing. And then in addition, in the contract, there's a lot of information about all of the additional training that they need to take part of to make sure that they're meeting state standards for the weatherization program.
Approximately how many households did you serve last year?
That's kind of a tough one because we were
Approximately.
look at Barb, 35. Yes. We have 3 different weatherization grants, so we kind of track them a little bit differently, but roughly in the 35. We will be doing a lot more than that in the coming years. So part of when we get to agenda item 8, it's adding more contractors so that we can do even more homes.
So it was lack of contractors that limited you from going beyond 35?
Yes, so we received a larger grant that started in November that significantly ramped up our program, but it's not something that can just happen overnight. So once we get the money, then we spent a lot of time over this past year onboarding more contractors so that we can do even more homes. So I anticipate that that number is going to grow exponentially over the next few years.
Any other questions? Commissioner Curran?
Thank you. Do you have a goal for each season or how many homes you would like to service?
Sure. Our goal that's set through the state is roughly 90 homes a year. So obviously we're much lower than that, but again, a lot of that has to do with ramping up of the program to onboard contractors. I know you all approved the position back in, I think January, maybe it was even past that, but another weatherization inspector. So it takes a while for people to get onboarded and fully trained. So there's just a little bit of lag time. It's going to take some time to get everybody up and trained and ready to go so that we can meet those numbers.
Sounds like you're still ramping up.
Yes,
Yeah.
we are still in the ramp up period. Yep.
Commissioner Miedema?
Is 90 the goal for community action agency from the state or as a whole for the county? Like, is there anyone else that partners with community action agency with weatherization in the county?
I guess loosely, maybe I'm not understanding your question. I'm sorry.
Are there other maybe nonprofits that maybe do similar work, like such as Love Incorporated or other?
I don't think that they do to the extent that we do. So our weatherization program is through several different grants, but one's the Department of Energy that has a lot of requirements. So there are places that do some energy audits, but not quite to the extent to which we do those.
That makes sense. Thank you.
Yep.
Other questions? Commissioner Moss?
Sure, just one question,
Sure.
maybe it's for legal possibly, but so the name on the contract is Sales Heating and Cooling. I believe the name of the corporation is Sales Heating, Cooling and Refrigeration. Does it need to match what's on file with the state? Or is it okay to use a different name?
I'll let you take that one.
It should match.
Please.
It should match.
So if it, could I just,
Maybe a typo?
looks like it. Could-
Okay.
Could I just motion to amend then that we use the
Yes, you can.
full
do that.
name? Support.
We vote on that motion?
And I'll clarify just that it's to make the name Sales Heating, Cooling and Refrigeration Incorporated.
Right, so those all in favor of amending the motion to make the name of the organization accurate, say aye.
Aye.
Opposed? Seeing none, motion passes.
May I ask what that looks like in terms of, and I can ask after too, but do we come back to, okay, it's
You
just,
shouldn't have to come back, I don't think.
okay, wonderful.
No, because we've agreed.
No, we'll just simply amend or edit the facing of the contract.
Okay,
Good question.
thank you.
Yes. All right.
And then when
Commissioner
it ends up in the board packet for our full commission, it'll be corrected.
I see. Okay, thank you for clarifying.
Thank you for that.
We can make sure they get paid real easily that way.
They will appreciate that, so thank you.
They will.
All right, so are we ready to go to a vote for agenda item number 6 to approve and forward to the Board of Commissioners with that motion now in place, the right name to provide weatherization services for Ottawa County Community Action Agency for the period of October 1st, 2023 through September 30th, 2025.
Mr. Bergman,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Mr. Moss,
Yes.
Mrs. Curran,
Yes.
Mrs. Ebel,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Miedema,
Yes.
Mr. Bonema,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Thank you. Moving on to number 7, very similar contract services for weatherization programs for Ottawa County Community Action Agency. The suggested motion is to approve and forward to the Board of Commissioners the contract with Randy Shalom.
Skolma.
Shalom, well, say it for me.
Skolma.
Builder to provide general contractor services for weatherization programs for the period of October 1, 2023 through September 30th, 2025. Do I have a motion?
I'll make the motion.
Second.
Go ahead. Is there discussion? Feels like we can go to a vote here. With no discussion.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
Mrs. Ebel,
Yes.
Mr. Belknap,
Yes.
Mr. Moss,
Yes.
Mrs. Medema,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Curran,
Yes.
Mrs. Cosby.
Yes.
Motion passes.
Thank you. Moving on to action item number 8, we have contracted services for weatherization programs for Ottawa County Community Action Agency. Suggested motion is to approve and forward to the Board of Commissioners contract with Alan McCabe, DBA A&S Construction, hopefully that's correct on the contract, to provide general contracting services for weatherization programs. Do I have a motion?
I'll make the motion.
Second.
Is there discussion? Seeing none, we'll go ahead and go to a vote.
Mrs. Ebel,
Yes.
Mr. Moss,
Yes.
Mrs. Medema,
Yes.
Mrs. Curran,
Yes.
Mrs. Rhodey,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Mr. Bonema,
Yes.
Mr. Bergman,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Thank you. Thank you, Jennifer. All right, moving on to action item number 9, we have inmate meal service agreement. Suggested motion is to approve and forward to the Board of Commissioners the contract with canteen services for inmate meal services. Do I have a motion?
So move.
Second.
Is there discussion? Good. Okay, because it doesn't look like anyone's here. So perfect. All right, seeing no discussion, can we go ahead and go to a vote?
Mrs. Curran,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Medema,
Yes.
Mrs. Ebel,
Yes.
Mr. Bergman,
Yes.
Mr. Bonema,
Yes.
Mr. Moss,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Thank you. Moving on to action item number 10 is a request to increase pay for a nurse prescriber for retention purposes. Now I know Eileen's here. So, and I should have known that. The suggested motion is to approve and forward to the Board of Commissioners the request from the Community Mental Health to increase pay for nurse prescriber from step 4 to a step 6 on the prescriber pay scale for retention purposes. Do I have a motion?
I'll
So
make
moved.
support.
Support. And discussion. Round. I have just one question. I put it, I put it forward in kind of our agenda earlier this week when it came out. Wage analysis. Do we do wage analysis at all for positions?
We did it.
Do you know? Like a nurse prescriber is probably nurse practitioner and kind of rate of pay.
They did that during the wage analysis, the study they did a couple of years ago. They looked at all of our positions and kind of compared them to, for us, it was other CMHs, but for the rest of the jobs, I don't think Marcy's here, but it's, there is some analysis done about similar jobs.
Just making sure we're staying competitive.
Mhm.
Yeah, so, okay. And if you'd like to share with us, what,
Sure, just that, this is, like you said, it's from step 4 to step 6. It's for retention purposes. The total amount will be, approximately $14,239. These are typically, very hard positions for us to fill. We really cannot afford to lose any of our current staff. We're already down. Our medical director has given notice, and we also have another vacancy in our nurse practitioner prescriber. So this is really just an attempt to help stabilize that prescribing services and keep good staff.
any questions of Lynn? Looks like none. Okay, thank you, Lynn. All right, we can go to a vote and to increase pay for a nurse prescriber for retention purposes.
Mr. Belknap,
Yes.
Mrs. Curran,
Yes.
Mr. Moss,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mr. Zylstra,
Yes.
Mrs. Medema,
Yes.
Mrs. Ebel,
Yes.
Mr. Bergman,
Yes.
Ms. Cosby,
Yes,
motion passes.
thank you. Moving on to action item 11, fiscal services personnel requests. The suggested motion is to approve and forward to the Board of Commissioners a proposal to add 1.0 FTE full-time benefited budget manager position at a universal pay grade of 15 for a total cost of $131,738 paid for by the general fund. Do I have a motion?
I'll make the motion.
Second.
And is there discussion? Karen, come up. Commissioner Bergman.
Sure. So Karen, is this position going to enable you to lighten your load or change your perspective on your job, or what's it going to do? Is
So-
this?
Yeah, so currently we have an accounting manager who really works through the general ledger and approves all of the accounting entries countywide. So this would be the equivalent on the budget side, just to help support that operation and allow me to not necessarily focus in on the most minute details.
Okay, good. Thank you.
Commissioner Zylstra?
Yeah, just, so this is a pay grade 15, right? So this is obviously a substantial position. And that's basically replacing the work of yourself and the assistant director, correct? On the budget side, right?
It's assisting us, correct? It's doing a portion of the things that we would do now.
The way I read that last sentence, it says the budget manager will manage the annual reporting and capital budget process. So that person will have authority over the budget, or is that still under your direction? How does that work?
Yes, it's the job description refers under the direction of the fiscal services director. So it is under my direction, which would be, under the county administrator's direction.
Any further questions? Oh, Commissioner Medema?
I guess I would love to request some additional information, maybe supplied before it would, maybe as it goes into the Board of Commissioner packet, possibly a job description.
That was human resources. I noticed that was missing too. They usually include that. It was in the email. I don't know how it got missed on the agenda, but we can send that and certainly add it to the packet.
Okay, thank you.
Mhm.
Oh, Commissioner Curran?
Thank you. Can you walk us through what the hiring process will look like and who will be involved in making the decision and who will ultimately have the final say on who's hired for this role?
Sure. So we post our positions with human resources posted on the website, and we take applicants. Generally, there is a team within my office that reviews applications, and we schedule interviews and make that decision. Usually we go through a two-step process where we have a first interview with human resources, and then we like to expand it and call some candidates in for a second interview. And that's generally done in our office so we can introduce them to, our office space, the culture. Sometimes they meet other staff or other managers. And so we just make that final decision, but the decision, generally I make the offers for all staff in fiscal services.
Okay. Thank you.
Commissioner Cosby, if I may share briefly.
Yes. Go
Thank you
ahead,
very much,
Commissioner.
Chair. Yes, fiscal services, let me just first start out by saying has done a really spectacular job throughout the whole budget process. They've been very responsive. We're doing things a little bit new this year in terms of having more information in the packets, and we're asking a lot more questions, and fiscal services has been just really, really excellent at adapting to that and just really matching the demand. So I just want to commend fiscal services and the Karen's leadership right out the bat for that. One aspect of that is I've been noticing throughout our process that sometimes we're preparing certain budget scenarios and changing the numbers and looking at what different scenarios look like because of the system that we use, which it does work, but it is a bit cumbersome. It sometimes takes a little bit longer
than we need, not because of our staff, but because of the systems we're using. So I do want to look at acquiring budgeting software as soon as we can. This is something that is standard practice with many counties all around the country. And the budget director position, who will be under Karen, will help not only with preparing the budget, but also bringing in and helping to interface with that budgeting software so that when we ask questions about the budget, when we ask what different scenarios look like if we increase this number or decrease that number, we'll be able to get a turnaround much faster that requires less labor from the folks in fiscal services. And I think that will facilitate a much faster turnaround and a smoother process that doesn't require as much intensive work on the behalf of fiscal services. So I think this is a very good thing that will save a lot of time and a lot of money in terms of labor hours. Thank you.
Excellent, excellent. So I know the CIP process is kind of refining, and it's something that you've been developing and looking outward for 5 years. So this position would support that work as well.
Correct. We also have an analyst that also supports that activity as well.
Wonderful. And then what I'm hoping for from that budget software that you're talking about is a report template that's like 1 page, because I've been asking, I know it's been a challenge, to know about the programs of various departments, what services they offer, total number of FTEs budgeted, total number hired, number of visits, their resources, their costs, and their outcomes. I'd love to have a 1 page, something like that for each program, not just health department, but each program. So it's just a quick way to understand the program, whether or not they have, they're being successful, and if they have needs that we as the Board of Commissioners can help support.
And I think as we review software vendors, I think one of the first steps in an RFP process would be understanding some of our goals so that we can make sure that it is attainable, or that we can review vendors based on some of the outcomes that have been discussed.
I want to start celebrating some of these highly effective programs, and that's the best way to do it. So.
And Commissioner Cosby, if I may speak to that
Yes.
as well. We are kind of in the pre-RFP process for such a product, and we did see one demo that did incorporate the functionality you're referring to. In other words, that's the ability to not just see financial numbers, but also non-financial metrics, and to produce reports based on those. So as we have our official kickoff meeting for the RFP, we'd love for you to be there and just really help us to get down in as much detail as we can, exactly what we expect out of a product that we're putting out the RFP for, so that we can turn around those things in an automated fashion and have less burden on our great folks in fiscal services.
Absolutely. Next year is a lot easier. Thank you, Karen. Any further questions, sir? Commissioner Bonema.
Yeah, Karen, when you are in the process of creating a position like this, that's a new position, could you explain a little bit the process that you go through to determine what pay grade is assigned to it? In this case, it's a pay grade 15. It's 131,000, almost 132,000. It's a lot of money. How do you decide that it's not a pay grade 10, and then they work their way up? How does that process work?
The process doesn't occur in fiscal services. It occurs in human resources. Oh, and she's here. Thanks, Marcy.
Marcy. So to answer an earlier question, we do a wage and compensation analysis. We do those every couple of years. And what we do when we did the last one is there's an entire document of how you rate the positions and where you put them at based on, I think it's approximately 15 different factors. Some of the ones to start with are knowledge and experience, education behind the position, the credentials that it needs to have. So we go through all those steps when we're placing them. And then we also look at outside comparables and internal comparability too. So that does take place in the HR office. Do you make that final determination? Do you assign the 15? Yes. You do. Okay. Yes.
That's through market analysis as well, isn't it, Marcy?
Correct.
Yeah.
Both. And there is quite a large document. I think it still exists out there that goes through all the steps of it. Quite a few steps that take place to make sure we have that internal and external comparability and have it in the right area.
Wonderful. Further questions? Seeing none, we'll move to a vote. Thank you, ladies, very much. So to approve and forward to the Board of Commissioners, a proposal to add one FTE full-time benefited budget manager position at a universal pay grade of 15, total cost of $131,738, paid for out of the general fund. Do I, go ahead, we'll go to a vote. I won't motion. Sorry.
Mr. Moss,
Yes.
Mr. Bergman,
Yes.
Mr. Zylstra,
Abstain.
Mr. Bonema,
Yes.
Mrs. Medema,
Yes.
Mrs. Curran,
Yes.
Mrs. Ebel,
Yes.
Mr. Belknap,
Yes.
Mrs. Rhodey,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Wonderful. Moving on to action item 12, foam concentrate tote trailers. Suggested motion is to approve and forward to the Board of Commissioners the purchase of the foam concentrate tote trailers and foam. Do I have a motion?
I'll make the motion.
Second.
And do we have discussion? Are these the same trailers that went along with our foam product? Yeah, wonderful. So we'll go ahead and go to a vote.
Could we hear about when it's coming? I think we
Oh,
have
sure. If Lou would
Director
like to
Hunt
come up,
with us.
Sure. I didn't
Above
know if
a
he wanted to come
ETA.
up or not.
He's been waiting so patiently all day.
Absolutely. I appreciate it. Thank you for having this on the agenda for sure. It's exciting to be moving forward with this capability in Ottawa County to give our firefighters and our hazmat team non-PFAS foam so they can aggressively fight fires that involve petroleum, chemicals, different solvents, alcohols, things like that. I think your question was, how long would we
ETA.
have to wait? So these are specialty trailers in particular. I think there's still some aluminum on them, which tends to be a bit of an issue. We've been told 4 to 6 months that we would have to wait to get those 3 trailers. And then as soon as we got them, we do some hands-on training with our fire departments so they know exactly that everything that they have will work with those items and they know how to use them.
Have the trailers been ordered already or you're waiting for this process?
We're waiting. So we put out the RFPs through fiscal services. We got 3 vendors that jumped into that process. We selected one, which is Firefighting Equipment Associates in Flushing, and they have the materials that we need.
Thank you. Other questions? Commissioner Medema?
Can you please remind us, Lou, did you guys determine the locations where they'll be stored throughout the county?
Yep. So we have agreements with 3 of our fire departments in Ottawa County. And really what we're looking at is some of the areas where we want to have them quickly deployed from. However, you don't want to have your asset right in the potential field of where you might have an issue. So there's a bit of a give and take with that, right? So we have one that we're putting in Holland Township. We have a number of issues over there in the Zealand area and in Holland City. We have one up in Ferrysburg and one in Allendale, again, to kind of cover all of our geography. The Far East area, we could also get some support from GR City if we really needed it. So we feel like that distribution is going to help us a lot.
Thank you.
Any further questions?
Thank you for addressing this public safety gap. I think chemical fires are a real threat in this day and age, and this will do that.
100%. I agree. Thank you.
Thank you. I'll go to roll call vote for the foam concentrate tote trailers to approve and forward to the Board of Commissioners the purchase of foam concentrate tote trailers and foam.
Mr. Bonema,
Yes.
Mrs. Ebel,
Yes.
Mr. Bergman,
Yes.
Mrs. Medema,
Yes.
Mr. Moss,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Curran,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Ms. Cosby.
Yes.
Motion passes.
Wonderful. Moving on to action item 13, facilities work order and room reservation platform contract. The suggested motion is to approve and forward to the Board of Commissioners a contract with Brightly Software, Inc. for computerized maintenance and management system, CMMS, and a conference room reservation platform for 3 to 4 year contract equaling $94,662.43. Do I have a motion?
So moved. Second.
And is there discussion? Would that be Blake? Are you timely? Yes.
You run just fast enough, you can make it.
Would you like to share with us?
So when I got here, we ran a system for our
maintenance management of our work orders, our PMs and stuff like that. It was called Facility Dude, a little bit antiquated, I know. They became a global company and changed their name and a lot of the stuff they did. So now it's called Brightly Solutions. It houses our database of all of our PMs, work orders, all that stuff. We also use it as a scheduling software for rental of the meeting rooms. So what this is for is we tried to do a 3-year last year, but corporate counsel didn't want to go long-term. So we're trying to get into a contract so that we can do more with them. This would be the platform that we base kind of our forecasting and stuff off from. They have add-on modules when we get to that point. So it's creating that consistency so that we can continue to build in our department the asset catalog and the capital management and all that stuff.
Questions of Blake?
The 3 to
Commissioner Bond.
4 year, the 3 to 4 year contract, how is it one or the other? Is it?
It's a 3-year.
It's 3 year.
Typically it's a 3-year and occasionally there's a option to add a year on or 2 at the end of it is historically how it was done. But after 3 years, we don't have to do anything. And I'm pretty certain that corporate counsel has kept the language in there that it's
3 years.
It's 3 years, but the county has the right to separate for any reason.
And when you talk about forecasting, that will be helpful for you for CIP, for instance, as well. So.
Yep, that's part of that whole process that we want to get to with the CIP program and stuff like that, is getting the asset database in there correctly so that we can forecast life cycle. How long do we anticipate? Of course, everything's, it's forecasting. It's not 100% accurate, but trying to, as many people will find in our C wing today, we have some air handlers that are just not working quite right. It's a little warm, but trying to forecast those type of events so that we're not just being reactionary all the time.
Perfect.
Mhm.
Are there other questions? Seeing none. All right. Sorry.
Madam
I can't
Chairman,
see you. I apologize.
it's okay.
Go ahead, Commissioner Belknap.
Just a question, Blake, when we talk about an asset inventory, how well or how far along in that process of, gathering, our site information and feeding this into this program? Has this been something that's been going on for a while? And you're kind of ramping up, or is this more of we're kind of starting that process? I'm just curious where we are in the building of the data set.
We're starting the process right now. We have some data in there. We had from Facility Dude, that was a 1996 or 98 platform that operated on. So it was really not intuitive. It was difficult to use. A lot of, facilities people don't usually translate into tech savvy oftentimes. So it was very hard for us to use in the field and keep it accurate. So with this newer version, it's a much more updated, mobile ready type system. So we're starting to, there was a large lift of getting the old data into the new platform. We've completed that about probably 2 months ago of getting the data over. It took almost a year with integration and everything. So we've got that done. And now we're starting to set those parameters of, we're unique. We're not a hospital. We're not a school. We're not like every other municipality. Everybody differs just a little bit. So trying to outline those parameters of how granular do we want to get as an asset to predict failure and to create PMs. And we're working with the company right now trying to, yes, these are assets that I want to track, but maybe they don't go into CIP. So how do we customize this program a little bit to do that? So I would say we're just starting to ramp up to define those parameters so that we can start labeling them.
Yeah, because it would seem to me that you'd want to have that inventory before you start assigning, work tickets and, that type of thing.
Yep. Yeah. And we have to, every time we add an asset, all the information goes in there of cost of replacement, this, that, the other thing. But also we have to build a PM, a preventative maintenance schedule for it, the routine for that. What does this asset get for work? So we have to build all those as we put the assets in. Like I said, we do have some assets in there from an old study that was done. My guess is probably by the time we're done with this, we'll exceed 5,000 assets, just countywide, just depending. Not everyone will have a PM to them. Some of them are just going to be a run to fail piece of equipment. But we can go as fine as a door latch, an electronic door latch for the card access. Their life cycle is 100,000 cycles. We can kind of predict that so that it pops up not only in, it wouldn't reach a CIP cost, but that doesn't mean we shouldn't track it. That means in 5 years, we should put in our operational budget a percentage of those so that they don't, if they fail, they never fail when you want it to fail. It's usually somebody calls and lets you know it failed. So.
Does Brightly software include like a barcoding for your assets? So that makes it faster for you to, okay. Good.
Yep, QR codes. We'll be printing those off. We've been experimenting with different mediums of what to print on: metal, laminated paper type weatherproof stuff, so that we can actually go up. We can basically put, like I could get as general as on the door, like frame behind the door. I can put a QR code. When custodial comes through, they can scan that. It will populate a PM list of everything that needs to be done in the room. So like in here, when we set it up for a meeting, we can scan that code. Staff will get a list generated on their phone or their tablet or whatever that says, you need to do this, 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 this. They check it all off. It's done.
I'm from the days of physical counting, so that is really helpful to hear. I'm happy to see that advancement. Wonderful. Any further questions? Seeing none, thank you.
Yeah, no problem. Thank you.
All right, so the motion is to approve and forward to the Board of Commissioners a contract with Brightly Software, Inc. for a computerized maintenance management system, CMMS, and conference room reservation platform for 3 to 4 year contract equaling $94,662.43. Go to a vote.
Mr. Belknap,
Yes.
Mrs. Curran,
Yes.
Mrs. Medema,
Yes.
Mr. Moss,
Yes.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Ebel,
Yes.
Ms. Cosby.
Yes,
Motion passes.
thank you. Moving on to action item 14, transcription services agreement. The suggested motion is to approve and forward to the Board of Commissioners the VIQ Solutions contract in the amount of $154,800 over 5 years. Do I have a motion?
I'll make the motion.
Second.
Okay. And is there discussion? No discussion? Want to go ahead and go to a vote? And that is to approve and forward to the Board of Commissioners the VIQ Solutions contract in the amount of $154,800 over 5 years.
Mr. Bergman,
Yes.
Mr. Zylstra,
Yes.
Mr. Belknap,
Yes.
Mr. Moss,
Yes.
Mrs. Ebel,
Yes.
Mrs. Rhodey,
Yes.
Mrs. Medema,
Yes.
Mr. Bonema,
Yes.
Ms. Cosby.
Yes,
Motion passes.
thank you. Moving on to action item fiscal year 2023 budget adjustments. The suggested motion is to approve and forward to the Board of Commissioners the 2023 budget adjustments per attached schedule. Do I have a motion?
So moved.
Support.
And is there discussion? Around the room, seeing none. All right, we will, the motion is to approve and forward to the Board of Commissioners the 2023 budget adjustments per the attached schedule. Go to a vote.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
Mrs. Ebel,
Yes.
Mr. Belknap,
Yes.
Mr. Moss,
Yes.
Mrs. Medema,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Ms. Cosby.
Yes,
Motion passes.
thank you. Moving on to action item 16, the appointment of a new vice chairperson for the Finance Committee. The suggested motion is to remove Commissioner Bonema as Vice Chair of the Finance Administration Committee and appoint Commissioner Belknap as Vice Chair for the remainder of 2023. Do I have a motion?
I'll make the motion.
Second.
Is there discussion?
Yes, yes.
Commissioner Bergman?
First of all, let me just say, this is very highly irregular. I see absolutely no reason to change. We've got 3 months left to this year. You're talking about changing. For what reason?
I think this was discussed. Is that being directed at me
Yeah,
as the chair?
sure.
We discussed this during the censor.
I don't remember hearing about the fact that we were going
Was open to debate. And
I remember we were going to do a censure, but nothing happened with the censure. And now you're saying that
recommendation, the
now this
recommendation was.
this
to
is the
remove from-
result of that censure. Is that what you're
Correct.
saying?
That's what I'm saying. Yes.
Okay. All right.
Commissioner Moss?
Sure, I'd say something a little different. For me, this is not related to the censure. That was a couple months ago. I have my, different reason for it. The censure was related, I believe the final motion that was voted on was a censure and possible removal from a committee, which was left in the board chair's hands. So that hasn't happened. And so this, in my mind, this is separate. And I guess I'd say that I trust Commissioner Belknap to lead this committee if the chair is not available.
Further discussion?
You want to go on? Go ahead. Okay, I'm not in favor of removing Commissioner Bonema from the position. I think for a lot of the reasons that Commissioner Bergman spoke about, but I guess I'm especially concerned that if this motion were to pass, only 6 members of the board would occupy the 15 leadership positions on the board. I understand that there's a functional majority here, but, we've talked about this many times, that this is a board of 11, and for the 15 leadership positions to be occupied by the same 6 members, I don't think that is beneficial for this board. I'll be voting no for both reasons.
Thank you. Commissioner Bonema?
Yeah, I'd like to provide some clarity as to why this is happening. Once again, Commissioner Moss and Administrator Gibbs are taking action against me with the intention of removing a voice of reason from the Ottawa County Finance Committee. This is cowardly, vindictive, and very unlawful. Where did this originate? Once again, Commissioner Moss is retaliating against an HR complaint that I filed against Mr. Gibbs for denying information to county commissioners for weeks. His response was blatantly insubordinate outburst at me in public after I politely asked him for the status of Nate Kelly's application, to which he yelled, "Get out of my face, dude." Twice. This brings us to the topic of harassment. What is harassment? And I'm going to quote the policy of Ottawa County. Harassment is any unwelcome verbal conduct that unreasonably interferes with an employee's job performance and/or creates a hostile work environment. While Gibbs' outburst was very public and happened right in front of the media, HR complaints are confidential. The only reason this complaint became public is because Joe Moss and John Gibbs conspired with corporate counsel to release my complaint to the media. They never met with me about it. Ottawa County has a very strong HR policy that clearly states, in quotes, no employee will be subject to any form of retaliation for making or pursuing an HR complaint. Let me say that one more time for you. No employee will be subject to any form of retaliation for making or pursuing an HR complaint. And yet here we are. First you censured me, and now this.
You retaliated by voting 6-5 to censure me for what you called an abuse of power. That's a lie. I exercise the rights I have as a county employee and as one of 11 members of this commission. I followed HR's harassment policy. You made this public, and you were the ones abusing the power with this vindictive retaliation. And now you choose to continue to be petty and immature with this vote to remove my voice of vice chair of this committee. Joe, you are always talking about how the media attacks conservatives, but you are the first in line attacking conservatives, specifically those who signed the contract with Ottawa, something you threw away months ago. Your word is as useless as the paper it is even printed on. Mr. Moss, you ruin your reputation as a serious person with your name calling, bullying, incompetent hiring, and creation and promotion of a divisive online blog that you personally own and control. You call it journalism, but it's self-aggrandizing, rambling, incoherent nonsense. It is a website filled with cowardice, stealing the names of real patriots to obscure your identity. This isn't brave conservatism, it's cowardice. You steal their valor and sully the names of Jefferson, Franklin, and Adams. These men signed their real names against an enemy that was vastly larger than them, knowing it would cost them everything, including their lives. You won a county election and became exactly the people you threw out of office. It's time to stop the foolishness. Public service is an honor. The people that support you deserve better than vague and unactionable resolutions that change nothing. Acting vindictive and cruel are not conservative values, yet you celebrate these actions as brave. Let's do real work that actually addresses real county issues. Shocking the public with irrational budget demands is both reckless and irresponsible. Public attacks on you are not because of your conservative values. It's because you operate in darkness and choose chaos over sound judgment. Actions like these spotlight your incompetence and generate additional broken trust with the citizens of Ottawa County. You are embarrassing conservative voters in record numbers. A real leader brings people with them and builds consensus. Real conservatives win on the virtues of our ideas. Real conservatives reduce wasteful government without destroying the lives of working families. Stop these backroom deals and no-bid contracts. Stop the wasteful spending and start honoring the contract with the people of Ottawa. Prioritize the people first. Give them the transparency and good governance that you promised. Votes like this do nothing but divide us further. We win on the virtue of our ideas, not on the force of our hand. Thank you.
I would just like to mention that I was a witness to that HR complaint. I was not included. You went around the chain of command and it should have been handled through the board chair. Good for you. And, excuse me, nope. And so that is unfortunate. It cost us 3 months of business here with the public display. And it's very unfortunate. We're here, Nurse Ratchet is here to work for the people actually that elected me. And that was really unfortunate, the 3 years or 3 months of media play. And it makes me not trust you as my vice chair. Are there any other discussions?
Sure, I guess I'd just like to
Commissioner
clarify.
Hollis.
Oh, thank you.
Sorry.
I guess I'd just like to clarify and be extremely clear. This has nothing to do with retaliation, has nothing to do with cruelty or being vindictive.
I think it has to deal with a pattern of behavior. And like you just said, members on this committee want a vice chair who they can trust and who they trust. That's my position, and that I trust that Commissioner Belknap would do a great job running this committee if you were not here.
Thank you. Commissioner Miedema?
I'm just sad I didn't vote for Commissioner Belknap back in January, so I look forward to voting for him as vice chair today.
Any further, Commissioner Rhodey?
And I would second what Allison said. I do also just want to point out that it has been very clear for months exactly who is working with the media. It's very clear which members of the Board of Commissioners the press carries water for and who they do not. And that the allegations that we just heard completely are counter to the truth that we all know to be true in regards to the media.
Thank you. Further discussion? Commissioner Belknap?
I would just like to make mention that I'm here to serve. I will be abstaining from this vote. I really feel it's the role of this committee to decide this matter. So I'll just be stepping aside.
And you were originally selected for this position, but we gave opportunity to Commissioner Bonema for this role. I'd also like to mention at a Lakeshore Advantage event, there was $100,000 promised for the next program that I was pressured to put on our next agenda, finance agenda. It was promised by 2 commissioners, at least one, was not going through the normal process of going through the finance board or through the Board of Commissioners for discussion. So with that being said, I'm going to go to a roll call vote for the suggested motion to remove Commissioner Bonema as vice chairperson of the Finance Administration Committee and appoint Commissioner Belknap as vice chairperson for the remainder of 2023.
Mrs. Ebo,
Yes.
Mr. Moss,
Yes.
Mrs. Miedema,
Yes.
Mrs. Rhodey,
Yes.
Mr. Zylstra.
No.
Mr. Belknap,
Abstain.
Mr. Bonema,
No.
Mr. Bergman,
No.
Ms. Cosby.
Yes,
Motion passes.
thank you. Moving on to committee reports, we have treasurer's financial month end update and Amanda Price.
Really quickly, I just want to let you know that we held our foreclosure auction last Tuesday, the 29th, I believe that was Tuesday. And I don't have final numbers for you because a few of the bidders might not have been valid bidders. So they might be pulling their sales. We did have one property that did not get bid on. So at the end of this month, you will be receiving something called a foreclosing governmental unit report of real property foreclosure sales. And that's something the board receives for 3 years, starting last year, pertaining to foreclosures. And this is all related back to the infamous Raffaele lawsuit. And so everything comes back to Raffaele. So you'll receive that report and it'll give you the number of properties sold, the minimum bid of that, the amount of sales. And so you'll have that information. And that's about all I have for you this week or this month. Any questions for me?
I did actually, when we were talking about COVID and pre-COVID, I wondered, do you track at all like business bankruptcies in the community, in the county?
I do not.
You don't?
No.
Okay, so just wondered what that rate looked like and whether or not we were recovering. So I'll find another source.
Okay.
Thank you, Amanda. All right, and next is update on proposed 2024 Health Department budget and returning the department to normal pre-COVID levels. John, this is our opportunity here to review the proposed draft version of the Ottawa County Public Health Department budget. And would you be willing to share your kind of current budget proposal?
Yes, sure, Cosby. Thank you.
So there's been a lot of talk about what we're looking at for the budget for public health. So just wanted to start with a few facts and go from there. So the aim of what we are looking at here is going back and adjusting to pre-COVID levels. The COVID pandemic is over, and we want to make sure that's reflected in what our budgeting looks like. And so that is kind of the overarching theme of what we are doing here. So I have a lot of comparisons to the last pre-COVID year around that time frame. So I'll be doing some comparisons between that and today. So let's start with the currently proposed FY24 public health budget, which does account for the end of COVID, and it does say no to the COVID grants and the COVID positions. So let's start out with that. One thing to point out is that the total number of employees in public health since the period before COVID has increased from about 90 to about 120. That's about a 1/3 increase, which is a pretty significant increase. That is higher than inflation and higher than the population growth of the county. In fact, 40, excuse me, I'm sorry.
Got the floor.
Okay, I just asked if there's a handout that we could be looking at alongside.
No, I'm
That'd be
just going through the
helpful.
notes right now.
Okay, so there's no handout we can look at while you're.
No, that's fine.
So we have no way of following along.
Yeah, you can follow along.
Order in the audience.
Talk to Gretchen about that.
I can have you removed.
Try it.
Can I have him removed, please, officer?
Joe, ready?
Let's go ahead and take a 10-minute recess. Administrator Gibbs, were you finished with your report before we were interrupted? Would you like to continue?
Yes, if I could continue. Thank you, Chair Cosby. So I was just saying that the primary motivating factor with what we're looking at for the budget for public health was adjusting to normal pre-COVID levels. So I'll be making some comparisons between that period immediately before COVID and now. So the current budget that we're looking at, even with the adjustments that have been made, is still 22% higher than the FY19 budget. This is actually higher than the FY19 budget if it had been adjusted for inflation. And so we are actually higher than that baseline of where we were looking at pre-COVID. As I was saying, the total number of employees has increased from around 90 to around 120. So that's about a 30% increase in staff in public health, which since that pre-COVID period is higher than the rate of inflation and higher than population growth. In fact, at a board meeting in August of 2021, 42 new positions were approved. And that was a significant portion of all the positions in public health, probably about 40 to 50%. That's such a high number that were approved for COVID. So we've rolled those back as well. Let me point out for reference as well that the county population has grown by about 4.5% since 2019. But the rate of growth of the budget for public health is much higher than that. As I've said before, we're 22% higher. County population has grown by only about 4.5%. So that means that the budget that we're looking at has risen 5 times higher than population growth since 2019. For comparison's sake, let me also talk a little bit about the original budget that had been proposed for public health that did not take into account the end of COVID. So that was obviously a much higher amount than what we're looking at now. In fact, it was about $3.5 million more than the public health budget we're looking at now, or about 26% higher. That budget would have been 14% higher than last year's FY23 budget, even though the county population only grew by 1% since last year. And that original budget that was proposed for FY24 would have been 53% higher than the 2019 budget, even though the county population has only grown by about 4% since that time. And inflation has not grown by that much since that time either. So narratives around massive wholesale cuts, eliminating programs are not really backed up by the facts that we're looking at here. In fact, to be specific, the FY24 budget that is proposed for health is about 9% lower than last year's budget. And again, this is higher than the 2021 budget by 7%. And in that year, of course, the health department met all of its requirements for all of its required programs. So we know that it will do the same this year. This is going to have an impact on the county budget of reducing overall spending. And so we are going to see a savings in the general fund spend from the overall county budget. Just like all American families and American businesses have been looking at their budget and adjusting things, we want to make sure we do the same as well to account for realities as they come up. And I do think it's appropriate to account for the fact that COVID is over and what we're looking at with the public health budget. So just to reiterate a few numbers here. So looking at the change in budget from 2019 to 2024 with what we're proposing, we're still looking at a 22% increase, even with the changes that have been made. And this is a rate of growth of about 5 times higher than population growth. If you were to look at the original budget that was proposed that doesn't have changes to account for the end of COVID, you're looking at about a 53% increase from 2019, which is more than 10 times higher than the rate of population growth since that time. So the current budget still is up, even with the modifications that have been made, and it's obviously more than enough to account for the essential programs that are being done by public health. So just wanted to kind of give that quick overview.
Thank you very much. And it's a proposed budget.
Rose, that's right, yes.
Proposed. Do you plan on getting those documents to the commissioners that you're referring to right now?
Oh, yes, absolutely. They'll definitely be in the packet for these next Tuesday. But before then as well. We'll definitely get that to all the commissioners for sure.
Thank you. So Administrative Health Officer Handley, would you mind coming to the podium? Give the opportunity here. Adeline, I'm going to ask you to raise your right hand and ask you to solemnly swear
Okay.
to affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth. So help you God.
I do.
Thank you.
Madam Chair. Could you explain where you're going with? I don't know if you have the authority to deputize our health.
Actually,
Director.
MCL law
Okay,
46.11K states in part that the board may require a county officer whose salary or compensation is paid by the county to make a report under oath to the County Board of Commissioners on any subject connected with duties of that office. So thank you. This is your opportunity to ask relevant questions for the Health Department Administrator. Commissioner Moss?
Sure, thank you. I had a couple general questions kind of about timeline and process. And so you've been familiar with the overall timeline of how the budget process is running starting August 1st?
The overall timeline that we follow that Karen, Fiscal Services put out.
Yeah. I think it went out in like a newsletter and some other things. Yeah, packets. Yeah. So starting August 1st is when the board at least saw a first draft budget. And from that time, we had, not quite a 2-month process for the budget, but it's due September 26th. Were you aware that the county added 2 extra public work sessions this budget process to increase transparency and give all the stakeholders more time for input, more time for discussion?
Okay, yes.
Okay. And then this year, we added extra time to consider the capital improvements plan.
Yes.
And were you aware that we made changes to that capital improvements plan after discussion?
I'm not sure if this, any specifics with that now, or if there's a vote or motion, I'm not sure.
Oh, okay. That's okay. Yeah, we did. We went through lots of discussion. And one of the changes actually was related to the health department and bringing some of the health buildings back towards compliance with ADA. So that one change that the board made was, specifically to assist the health department in working towards ADA compliance. And on August 21, commissioners, communicated a desire to go back to pre-pandemic spending levels. Offhand, do you know how many weeks were left in the budget process at that point?
From August 21. It's gotta be about 4.
Yeah, 4, maybe a little more. Yeah. About 3 weeks in, 4 weeks left. Yeah. So more or less halfway, I guess. And at that point, there were also at least 4 scheduled public meetings for budget discussion and things like that, including today's. So a couple other things I wanted to get on the record. 2020, the budget expenditures were about 12.2 million, I believe. 2021, they were up to 13.4 million. And that current draft is at 13.8 million. Is that right? Okay.
Yes.
And let's see. From 2019, that budget went from 13.6 million and increased by about 36% up to 18.5. We know there's been some pretty significant growth. There was a big response to COVID, which makes sense. So during this whole process, there's been, time for discussion and, working through all this, but we still have, 3 weeks left still from today. Yeah. So anyway, I just want to highlight the timeline of all this.
Because by no means in the last 2 weeks or the last 3 weeks or 4 weeks has any budget been finalized, and we still don't have one. So,
That's good to hear.
yeah.
Because
Yep.
it has not felt or seemed like a discussion until this point. So
Yeah,
It's good.
so then one other question that's kind of unrelated to process. Can you explain why the health department tagged the following organizations in its August 24 Twitter post? The Michigan Department of Health and Human Services, the Michigan Attorney General, the National Association of County and City Health Officials, and the Network for Public Health Law?
Ask her about things that she didn't do. I'm her attorney and I would like an opportunity to discuss with her if you're going to take testimony under oath. There was no prior notice of this. I don't know even if corporate counsel knows about this. It's highly unprecedented and I would like an opportunity to talk to my client if you're going to ask her about things that she's not in charge of. So
She's
I would ask
not
her
in
this.
charge of. Okay. Yeah, you feel free. Or if you don't want to answer, that's fine too. I'm just wondering why those organizations were tagged, like the Attorney General and Michigan Department of Health and Human Services, tagged on Twitter in your posts about the budget.
I mean, I would ask that we take a recess so that I can talk to my client and prepare her at least somewhat for sworn testimony. Clearly, she was given no prior notice before today, that she would A, be allowed to speak at all, or B, that you'd want to take testimony under oath from your own health officer. So I think it's only appropriate that she be allowed to talk to counsel if you're going to go to this kind of depth without giving her prior notice.
No, I can absolutely withdraw the question. That's fine. I'm just curious, so it's not a big deal. Just wondering.
But if you
That's it.
if you feel like you have a need to do that right now, I'm absolutely open to taking a recess. Apparently, we need to vote on that. But I do have some materials for reference for her as well. They're just things that box 17, for instance, in the Holland Sentinel. Can I give those to Corporation Counsel to give to you
Sure.
to review? We can take, how many minutes would you like?
I don't know, 10 would probably be sufficient.
Okay,
Madam Chair, I motion that we take a 10-minute recess.
is there support?
Support.
There you go. I think I'll put these into public record. I'm giving those to. All right, so we'll go into recess for 10 minutes. We'll meet back again. Oh, I'm sorry. So, all those in favor? Aye.
Aye.
Aye. All those opposed? We will return at 1:50. session. Thank you. And Commissioner Moss, would you like to ask questions?
Sure. Just that last question, wondered if you were interested in answering about why MDHHS and the Attorney General was tagged on a public post on Twitter.
Before you answer that question, I would like to register my formal objection to this process, and my client was not told she was gonna have to answer any questions. In fact, she was just summoned here without further explanation. She's definitely willing to answer your questions though, so that would write, but I definitely want to register that formal objection as her attorney.
It'll be recorded. Thank you. And you're welcome to stand by your side if you'd like as well.
I'm good here. I can hear from you.
Okay.
Thank you, though.
Okay. Commissioner Moss?
Yeah, just
Or
curious.
So I asked at break here because I wasn't sure. These are agencies that have an interest in our funding and are directly impacted if we have to close our doors and cannot provide local public health services. So we have, anytime we have interests, specific interests in what information we're posting, we'll tag.
So then what did you want them to do with the information?
To be aware, because they're the ones that have to run the local public health department functions if we are not able to function.
Thank you.
Mhm.
Any other questions? I have a question. Why would you think that we would be closing the health department?
I was given a budget request for 2.5 million for general fund funding. That does not meet our minimum maintenance of. You cannot count that for minimum funding requirements. So then we would not get any of our state block grants or any state funding because we're not meeting the minimum funding requirements, which means we only can operate on the general fund that's remaining when I take 1.7 away from 2.5. And those were concerns that were raised about what our minimum funding for services and our service level requirements that we have to meet. And all I got back was thanks for that information, proceed with $2.5 million budget. At that point, we're looking at health department closing 4 weeks after October, and the public deserves to know it's a significant threat to public health.
But there are 11 county commissioners. There are Adeline, and I would never, ever vote to reduce the budget to that degree where it would put the public health at threat. I never would.
I think that's a conversation for Administrator Gibbs. The direction I got from Administrator Gibbs was 2.5 million. And when I raised concerns, it was 2.5 million.
This is why I asked you for FTEs, both budgeted and hired. I asked you about your programs. I asked you about your visit volumes. So I knew your business, so I can defend you and defend the public health department. That was my objective. I don't think I received the total of that information, especially the visit volume. I still don't know which programs are really successful. And I'd love to know that so that we can throw more, it's like resources behind them. But it's come in with drips and drabs. And my intention purely was to understand your business so I could be helpful as a 30-year nurse. And I've worked in leadership roles, so I understand kind of what's necessary to make that determination.
I've shared the information with you that I had available and readily, easily accessible. When I have 48 hours to try and determine some way to function with an unfunctionable number, that's where our efforts and our attention goes to. So as I said, when I emailed you that I would get you the numbers as soon as I could get to them, but I was under the direction from Administrator Gibbs.
But per that 12-page document, my private email to John Shea, that looks like it's been my private email chain from December. I've been asking for that same information, honestly, since November.
And I believe in that email chain, you'll see I've been inviting you to the health department to learn about our programs since December. And I have not had any taking up onto that.
But not any others. So, okay. Are there other questions? Commissioner Miedema?
As we continue to work through the budget process, Adeline, I would really like to request information related to dental services specifically.
I'm sorry, wait, what? Can you say it one more time?
I would love to request, as we continue working through the budget process, I would love more information related to dental services, such as Miles of Smiles. If you could perhaps even just maybe make a 1-page that shows volume of people that have received services from like 2019 through the present. so that we can see the workload that is currently happening. I know that oral health leads to overall health. And so I think that would be really good for us to be able to see the data on specifically dental services.
Commissioner Ebel. Commissioner Zelstra.
Yeah, I guess I'd like to make a request as well as Administrator Gibbs, if we could have as soon as possible some of the data you're talking about, and then some sort of budget as soon as possible, right? I mean, I understand Commissioner Cosby's concerns, as well as Commissioner Miedema's. We all have questions, and, you know, I have questions too. So I think that, you know, it's only fair that you know, we didn't have anything in front of us while you were reading. I think that that's, you know, lamentable, but it is what it is. I think that if you have something you can send us tomorrow, I think we'd appreciate that. The more time we have to prep, the better we'd be.
You will receive the budget as always, so you will.
So you won't, so you're not promising before Friday. You're giving us 3 days to examine the whole budget.
You have the budget, and you'll have time to review it.
But well, which day will that be?
I can't make any guarantees on that.
Okay.
Commissioner Bonema.
Addie, thank you for being here today. You and I have had many conversations even before I was sworn in to become a commissioner. I always felt that your door was open. I always felt like you wanted to have conversations, even if they were uncomfortable conversations. I admire that. When we've sat down, you've listened, and then you've worked with me to problem solve. And then you followed up with me on different things to implement to address my concerns. So I respect that. I think that's where trust is built. I think my time spent in the health department buildings, walking with you at times, getting to know your staff, getting to understand the services, getting to really get a better understanding of the full and complete services that you provide was really beneficial. Have you spent time with other commissioners to my right to do the same thing for them?
I have not. The offer has been extended. I think every time I come and speak or present for the board or send information, extend it. I have not heard from any of the commissioners now.
So in 7 months or more of being a county commissioner, they've not come through the door to spend any time with you to get to know you or your services?
No.
I think that speaks for itself.
So Adeline, do you recall speaking with someone from Fox 17 on or around August 30th of 2023?
I'm assuming this is in the documents you sent. Or you provided?
Yeah, then Matt Woodcoast wrote the article.
Okay,
And give them to you.
sure.
So did you state, I have not been involved in any of the conversations about public health programming and its potential cuts?
With Administrator Gibbs, correct? Yes.
Did you state, I have reached out numerous times to ask to be at the table or to say this is complex and we should meet and discuss with fiscal services? I have not received anything.
With Administrator Gibbs, correct?
Okay. So. And another question I have for you. Do you recall speaking with someone from Holland Sentinel? Sarah Leach wrote an article on or around August 30th as well on 2023.
Okay.
Is that a yes?
This is in the document too.
Yeah, that's that
Mhm,
other
yep.
document. Did you tell the Sentinel that cuts to your budget could potentially close the health department altogether?
With the 2.5 million that I was given, yes, correct. I stand by that statement.
Did you state, quote, and to me, this is a threat to the foundations of the public health and the health and safety of our community?
Absolutely. No public health in the community is a threat to the health and safety of the community. I stand by that statement as well.
Okay. Did you tell the Sentinel that you offered to discuss public health programs, funding, and legal requirements on numerous occasions?
With Administrator Gibbs, yes,
And those offers went unaccepted?
correct.
Did you tell the Sentinel that the Fiscal Services Department is now creating the Health Department budget and bypassing you and your staff altogether?
Based on the email I got from Administrator Gibbs, yes.
Okay. And you've got that article in hand, so. Right. Don't know if there's any other relevant health department information we need. Commissioners, any further discussion? I have emailed you. I am so sorry. I mean, I called too. I missed an email. It was when I was transitioning from my personal account to the county account. I missed one email. I looked at those 12 documents very closely. And I apologize for that, but I did also call. I left a goofy message, and I asked to meet with both of you. And I'm trying to remember specifically the timing, but I think it was before the 16th, actually. No. Do you have any questions of the board? Have any questions? All right, thank you very much. We are moving on to our second public comment. State your name and location, and you have 3 minutes and speak to the board chair.
My name is Kristen Megan Kelly, and I live in Hudsonville, Michigan. Many of you know I am a seasoned exposure scientist, public health professional of 21 years in the field of occupational environmental health and safety. I come here because I worked for the federal government for 12 years, and that was for 2 agencies in multiple states, including other countries. So I find it very hard to understand how hard it is to always be prepared for budget increases, reallocations, and decreases, because the government should not always be overspending. And as we sit in this meeting, we heard requests for increase in funding, and I think that's for some great programs. However, every annual year, we should always look to cut if we can, and that is by looking at services. What services are being utilized? If only 5 people are using a service, I don't know if we need that. Also, since the national media is here, I would like for this board to understand that the current interim health officer, through her attorney, they made a statement to say that the main board appointed an unqualified political ally for the position that she currently is internally holding. I'm going to post my husband, Nate Kelly's most up-to-date resume because he doesn't have social media. No, I'm not his white knight, but we work in the same profession. So I'm also able to vet someone that actually has the state requirements, which are, he has an MPH, and the top tier is a 3 years of administrative experience in public health. Well, he has 8 years. And I think there's a misconception that you must work for the government to work in public health. And because I work in public health, I can tell you most people do not. It's the same people who think that industrial hygienist can only work for OSHA, which is false. Also, being a former federal employee, the things that I have seen come out of the staff at the health department is stuff that I've been vocal about since I moved here in 2015. So my stance has nothing to do with my affiliation with the in waiting appointed administrative health officer pending state approval. It's because of me and myself. I'm a health freedom activist, and I use my powers for good. And seeing all this COVID funds go away needs to be done, because there was, to me, in my opinion, fraud, waste, and abuse. We did not utilize these COVID funds to use risk reduction methods that provided a greater than 90% risk reduction through engineering controls of dilution, destruction, and filtration technologies. Instead, useless masks that provide a less than 1% risk reduction with no instructions on how to don, doff, change them out, with no consideration of individual health issues. Public health programs need to make sure they're never putting someone who, again, has social media links to these resumes if you want to share them. But also another MD and MPH, just like Dr. Rob Davidson has been vocal against Nate Kelly. He has a support letter from Dr. Peter McCullough, an MD and an MPH. Thank you for these budget cuts. They are much needed. Thank you.
David Moore. I first of all want to say that I had told the board a few weeks ago that I was going to be sending a video your way. Recent activities and increase in my responsibilities are going to make that have to be delayed. I'll try to pick a time when you don't have so much on your plate. That being said, I am also the spokesperson for the 2 recall petitioners for a couple of board members. And I find it hard to believe that somebody can't vote for protecting the innocence of a childhood. But that being the case, it's a whole nother issue, and it's an area that I intend to dive into with all that I am. I also tell you that as a citizen, when I walk in and see this facility being used and a lawyer for somebody that's been filing lawsuits, talking to county commissioners, it raises my eyebrows. And also, I got to say this, we're supposed to go in front of the elections committee for approval of the language for the petitions. When I walked out of here at one of our breaks, Mr. Roebuck decided that him and I needed to have a conversation. It was anything but pleasant, because he didn't like what I had to say at the previous time about how the elections are so important to a republic, and you need to do what you got to do to make sure they have integrity. To me, that says you need to spend what you need to spend, and you need to apply what you need to apply for the integrity of the people of Ottawa County. I never once implied that Justin had not done a good job or was not qualified. But that being the case, and the animosity I felt, when I go before your elections committee for approval of language, I want those 3 people replaced. So I don't believe it's an even playing field or a fair playing field. All I want is truth. It's all I've ever wanted. It's all I ever want. I'm not playing no good old boys game with nobody, but I will play. I expect something to change, and I appreciate your time.
Thank you. Further public comment?
Nancy Emmert, Grand Haven. Your request to have Adelaide swear under oath was insulting and demeaning. She deserves an apology.
Thank you. Any further?
Gail Harrison, I would like to encourage all of you to come to the health department tomorrow at 4:30, rain or shine, to see how the community is responding to your outrageous behavior. Thank you.
Thank you. Are there any further public comments? Seeing none, this meeting is adjourned.